A very good evening to all of you. So, I hope you all are doing well. So, today we all are gathered here to discuss the previous year questions specifically for the FMG aspirants of pharmacology. So, today I will discuss most of the previous year questions of pharmacology. Okay, for the FMG aspirants, we will try to cover all important topics in the next 2-3 hours. Okay, so this session is going to be highly useful for you. Pharmacology is one of the major subjects from which you get many questions, nearly 15 questions out of the 300 in your FMG exam. So it's going to be a very highly effective revision for you. At the end of the session, you will feel confident in most of the important topics, must revise topic. Now, most of the students already know my way of teaching. Whenever I discuss any MCQ, any previous year question, any MCQ, I don't discuss only that particular question. I discuss that topic completely. So in the same way as we have continued all the PYQs in other subjects, we will do the PYQ here also. Okay, so basically we are discussing previous year topics, not previous year questions. So question by question, I will show you a question. First you guess the answer, then we will discuss that question and we will discuss that topic completely. So I have selected the most important topics which are must revise before going your exam, and there is high probability that maximum questions that you will get in your FMG, upcoming FMG exam from pharmacology will be from these topics. So are you people ready? Can we start? Can we start? Give me a thumbs up. Are you people ready? Let's start it. Let's start it. So without wasting any further time, the first question is in front of you. Okay. Which of the following anti-tubercular drug may precipitate gout? The four options are in front of you. Is it pyrazinamide? Is it rifampicin? Is it streptomycin? Or is it isoniazid? So the question is from ATT. ATT is a very important topic, that is anti-tubercular treatment. So you usually get a question from ATT. Okay, got it. So first you guess what is the correct answer? What is the correct answer? Is it rifampicin? Many students are saying the answer is B. I don't think so. Is it rifampicin? They are asking gout. Come on, people. The correct answer is pyrazinamide. So let me discuss all 5 important ATT just in the next 10 minutes. In the next 10-15 minutes, I am securing one MCQ in your exam. Okay, so it is worth giving time. Okay, so let's discuss anti-tubercular drugs, anti-tubercular treatment. Anti-tubercular drugs, anti-tubercular treatment. Okay, so there are 5 first-line drugs in the treatment of the TB we use. It is isoniazid, which is represented by the letter H. The second is rifampicin, which is represented by the letter R. Pyrazinamide, Z. Ethambutol, E. And streptomycin is S. So basically we are having 5 drugs. HRZES. What is HRZES? Isoniazid, rifampicin, pyrazinamide, ethambutol and streptomycin. Don't dare to change the sequence because I am telling you all important points in the particular sequence. So we will discuss these 5 drugs very quickly. Okay, so basically I want you to make this table, or otherwise I will provide you the notes. HRZES. The important points you have to write in comparison, the mechanism of action of each of them and the side effects of each of them. Currently, our question is one of the side effects. They are asking gout is happening in which of them? Gout is hyperuricemia. So which of them is leading to hyperuricemia? So we have to see the adverse effect of all of them. Okay, the uses, there is no use to say the use, they all are. The use of all of them is TB only. No? They all are anti-TB drugs. So uses I am not telling you because the use is same. It's TB. So basically you have to learn the mechanism of action and adverse effect. So these are the 5 drugs, the same sequence. HRZES. You know, 4 of them are Sidal. They kill the bacteria. They kill the bacteria except one. It is a question, it's the MCQ, it's the PYQ. The exception is the ethambutol. Ethambutol is a drug which do not kill the TB bacteria, Mycobacterium tuberculosis. No, it inhibits the growth. So only ethambutol is static among them. Remaining all are Sidal. You got it? Remaining all are Sidal. Sidal means they kill the Mycobacterium tuberculosis. And static one do not kill the Mycobacterium tuberculosis, only inhibit the growth of the Mycobacterium tuberculosis. So only ethambutol is static, rest all are Sidal. You have to learn. Now see, TB is happening most commonly. It is pulmonary TB. It is happening in the lung. Most common site of the TB is the lung. These are the alveolar cells. Okay, now where is Mycobacterium tuberculosis? Mycobacterium tuberculosis is present inside the cells also and outside the cells also. Okay, now we are having 5 drugs, HRZES. So which drug, which among the 5 drug is killing intracellular bacteria, which is killing extracellular bacteria, which is killing both? You are getting my point? You also get questions on that. So among the 5 anti-tubercular drug, which of them kill intracellular bacteria, which of them kill extracellular bacteria, and which of them kill both? So please learn isoniazid, rifampicin and ethambutol. These 3 drugs kill both, intracellular as well as extracellular. But the pyrazinamide, it kills only intracellular. And streptomycin, it kills only extracellular. So please learn it. You get questions on this also, questions on this also. Okay, the first three drugs causes hepatitis. The first three, the maximum hepatitis is caused by Z. So HRZ causes hepatitis. Okay, but the remaining two do not cause hepatitis. Hana. Now about the gout. The fourth and fifth causes gout, hyperuricemia. The fourth one and the fifth one, these both causes gout. But the first, second and fifth do not cause the gout. Okay, so this is simplified version I told you. How many of you got it? How many of you got it? Please learn it. Please understand it. Say yes if you got it. Can we go ahead? So please learn it. Please understand it. So what I said, okay, in the end we will write. Now tell me the mechanism of action of all five drugs. Can you see? This is the bacteria. This is the bacteria. The name of the bacteria is Mycobacterium tuberculosis. Say yes. Hannah, I want to kill this bacteria by 5 drugs. HRZES. Okay, what's the mechanism of action of these 5? Among the 5, 3 of them act on the cell wall. Can you see the blue color cell wall of the bacteria? So H, Z and E. H, Z and E. These 3 drugs, that is isoniazid, pyrazinamide and ethambutol. These 3 inhibit cell wall synthesis. I will tell you the exact step also. These 3 inhibit cell wall synthesis. No cell wall synthesis, the bacteria will die. The bacteria will rupture and die. Say yes, Hannah, got it? Number 3. One of them, that is rifampicin, it inhibits RNA synthesis. RNA from the DNA. R for R. Rifampicin inhibits RNA synthesis. It has nothing to do with the cell wall. It inhibits an enzyme. The name of the enzyme is DNA-dependent RNA synthesis. DNA-dependent RNA polymerase. So this enzyme is inhibited, so no RNA synthesis. And one of them, that is streptomycin, the last one, it inhibits the ribosome. No ribosome, no protein synthesis. So one of them inhibits the protein. Say yes if you got it. Ultimately, all 5 are killing this bacteria. I mean, 4 of them is killing the bacteria. One of them, that is ethambutol, do not kill the bacteria, inhibit the growth. So the 5 drugs, the mechanism of action of all 5 is in front of you. Say the mechanism of action of all 5. H, R and E. These 3 inhibit cell wall synthesis. What about R? R for R. R inhibit RNA synthesis inside the bacteria. And streptomycin, it's an aminoglycoside. It inhibits the protein synthesis inside the bacteria. Everyone say yes. Do you have any confusion here? And I told you these 4 are CIDL. Only one is static. The name of the static is ethambutol. You cannot afford to forget it. Now see, this, the blue color cell wall. See the blue color cell wall. How does the cell wall form in the bacteria? This is the mechanism by which cell wall is formed. For the synthesis of the cell wall, the blue color cell wall in this bacteria, 3 enzymes are required. What are the name of the 3 enzymes? FAS1, FAS2 and arabinosyl transferase. What is FAS? Fatty acyl synthetase. Fatty acyl synthetase 1, fatty acyl synthetase 2 and arabinosyl transferase. So I told you there are 3 drugs now. They inhibit the 3 enzymes. So H inhibit FAS2. Z inhibit FAS1 and ethambutol inhibit arabinosyl transferase. If any of them is inhibited, cell wall will not form. The cell wall will not form. The bacteria will be dead. So this is a way you can learn the mechanism of action of all 5 drugs together in one shot. Say yes, you get questions on that. Okay. So these 3 are inhibiting the cell wall, but the enzyme is different. The H is inhibiting FAS2. The Z is inhibiting FAS1. And ethambutol is inhibiting arabinosyl transferase. How many of you got it? Can we go ahead? So this is a way you have to learn. So till now what we have learned. Now we will go through a quick in all the 5 drugs. So you tell me HRZES. First learn the names. These are the 5 anti-tubercular drugs. These are used in the treatment of the TB. So you have to tell me their mechanism of action in one line. Okay, you have to tell me which of them is CIDL and which of them is static. You have to tell me. You have to tell me which of them kill intracellular bacteria, which of them kill extracellular bacteria, which of them kill both of them. And you have to tell me which of them causes hepatitis. And you have to tell me which of them causes gout. So I guarantee you one question from this table. Take this master table from my side. Okay, ultra high yielding important table. So HRZES. Learn the classification first. These are the 5 anti-tubercular drugs. Okay, mechanism of action I told you. H, Z and E. These 3 inhibit the cell wall of the bacteria. The synthesis of the cell wall. These 3 inhibit the synthesis of the cell wall by inhibiting different enzymes. H inhibit FAS2, you know FAS2, okay. Z inhibit FAS1 and ethambutol inhibit arabinosyl transferase. Learn the enzymes also, okay. R inhibit RNA synthesis by inhibiting an enzyme. The name of the enzyme is DNA dependent RNA polymerase, okay, because the RNA is formed from DNA. So DNA dependent RNA polymerase enzyme. And S is the aminoglycoside. It is inhibiting what? Protein synthesis. It is inhibiting protein synthesis by inhibiting the ribosome. So this is the mechanism of action. Which of them are Siddle? So all of them are actually Siddle. 4 of them are Siddle except ethambutol, which is static. So usually ask PYQ. Which of them is killing intracellular, extracellular, or both? So H kills both, R kills both, and ethambutol also kills both. Okay, ethambutol also kills both. The 3 which are inhibiting the cell wall, they are killing both. I'm sorry, no, rifampicin is not among them. Anyways, Z is killing only extra and S is killing only intra. Okay, you have to learn it. Okay, you get question on Z and S, which is killing only extra and intra. What about the hepatitis? Who will tell me? The first 3 causes hepatitis, maximum in the third one, that is Z. The next 2 do not cause. The next 2, hai na? E and S do not cause. What about the gout? The third and the fourth, that is Z and E, which is our question right now, gout. So Z and E both causes gout, the third and the fourth. So if you learn this table, maximum questions are covered here. Say yes if you got it. So quickly have a review. So isoniazid, it kills both intra and extra. It is the drug of choice for TB. It is the drug of choice for prophylaxis of the TB. Okay, and you know the mechanism of action. It inhibits FAST2. No FAST2, no cell wall, the bacteria will be dead. Adverse effect, you know one of the adverse effect, it causes hepatitis. Learn 2 more. It causes peripheral neuritis and hemolysis and G6PD deficiency. So learn 3 side effects of H. Now coming on R. I told you it is also bactericidal. It also kills both intra and extra. It is the most potent among 5. So what is the drug of choice among 5? What is the drug of choice? Drug of choice is H. Drug of choice is H for TB treatment as well as prophylaxis of TB. Drug of choice is H. But which is the most potent? The most potent among the 5 is R. So these are 2 different questions. Don't get confused. Okay, R is most potent among them. The mechanism, you know, it inhibits RNA synthesis in the bacteria. By inhibiting an enzyme, the name of the enzyme is DNA-dependent RNA polymerase. Say yes. DNA-dependent RNA polymerase. Adverse effect, it also causes hepatitis. But one more adverse effect you have to learn. It causes all the secretions in human body orange or red. So the tears, the nasal secretion, the urine, all the secretions will become orange or red. So, you know, ask the patient, don't get anxious or don't get worried when the urine is red in color. It's not blood. It is a side effect of this drug. Pyrazinamide, it kills only intra, not extra. Okay, and it inhibits the enzyme FAST1. So no FAST1, no cell wall synthesis. It also causes hepatitis, maximum hepatitis, but it causes gout also. It causes gout also. Ethambutol is one which is static. Rest all are Siddle. This one is static. It is the least toxic among all 5. Least toxic. It inhibits this enzyme. No ribinosyl transferase, no cell wall synthesis. It causes optic neuritis, gout. Along with the gout, it causes optic neuritis also. That is color blindness, optic neuritis, and few CNS symptoms. And last, streptomycin. The last is streptomycin. It is a weak drug, very weak drug, and it inhibits the ribosome. 30S and 50S of the ribosome, no protein synthesis. No protein synthesis. The side effects are on HT. You can learn the mnemonic on HT. It is ototoxic, nephrotoxic, neurotoxic. Ototoxic, person become deaf. Nephrotoxic, neurotoxic, है ना? H is hypersensitivity, that is allergy, and T is teratogenic. Never give S to a pregnant lady. So tell me, we are done. We are done. I guess we are done. Can we fill this table quickly? Coming on the next question then. So in the introduction, you can write down Siddle, static Siddle. Okay. It kills both. It kills both. It kills both. But this one kills only intracellular. This one kills only extracellular. You have to learn this. Okay, this is the introduction. This is drug of choice, H. The most potent is R. And least toxic, least side effect is E. So this is the introduction we have completed. Mechanism of action, you already know. This one inhibits cell wall. This one also inhibits cell wall. This one also inhibits cell wall by inhibiting different enzyme. This one inhibits RNA synthesis. And this one inhibits protein synthesis. So you have to learn the exact enzymes also. Adverse effect, just enumerate it quickly. What are the adverse effect? So here we have hepatitis. Okay, and here we have gout and gout. So write down these one, which you already know. Now tell me the extra. So along with the hepatitis, here we have peripheral neuritis and hemolysis due to G6PD deficiency anemia. Okay, peripheral neuritis. Here in addition, we have orange or red color secretions everywhere. Orange or red secretions. Here nothing additional. Here we have optic neuritis as additional. And here the mnemonic was on HT. So it is ototoxic, neurotoxic, nephrotoxic, hypersensitivity and teratogenic. This is the best or the most easiest way, in the 10 minutes, I can cover a complete chapter, that is ATT. Hannah, very frequently you get questions among them. Give me a thumbs up, everyone. Can we go ahead? Say yes if we can go ahead. Please allow me to go ahead. Yes. Can we go to the next question? The next question is in front of you. Okay. Are you people there? Kindly respond. Huh? Say yes. You got it? How many of you like this way? So in this way only, we are going to cover all the chapters, maximum chapters, I mean. Okay, it will be a highly effective session. What you are asking, on HT mnemonic for streptomycin only. Yes, absolutely. On HT mnemonic is for streptomycin, that is aminoglycoside. Okay, so coming on the next question is in front of you. Read the question, tell me the answer. Tetracycline inhibits protein synthesis by inhibiting which step? So tetracycline is a protein synthesis inhibitor. So the next question is based on the antibiotics which act by inhibiting the protein synthesis. Can you guess the answer? The 4 options are in front of you. Is it inhibiting initiation and misreading mRNA? Is it binding to 30S and inhibit amino acyl tRNA? Is it inhibition of peptide transferase activity or inhibition of translocation? So how do you learn this? So no, yes, the correct answer is B. Most of you are right. So let me take this chapter. It's a big chapter. It will take 20 minutes. But in the 20 minutes, I'm securing you one question. I'm going to cover 4 drugs. Okay, all these drugs which inhibit protein synthesis inhibitor. You want me to take all or you want me to tell you only about the tetracycline? Just give me your views on this. Now, you want me to take all protein synthesis inhibitors, the 4 drugs, the tetracycline, the chloramphenicol, the aminoglycosides, and the erythromycin, that is macrolide. So you usually get question on any of them. It is not necessary every time you will get the question on tetracycline. Okay. So in the same way, in a tabulated manner, in the 10-15 minutes, I will cover all complete chapter. So I cover all the chapters in pharmacology like this only. In a comparative table, I teach always pharmacology. So that all the drugs of that particular chapter, you cover in the master charts. So I call these as master charts. So I am having 20 master charts with me of entire pharmacology. So, but if I provide you 20 master charts, you will get nothing. You imagine if I am not taught you and I'm just providing you this master chart, just read it. You will say, Ma'am, what is this intra, extra, siddle? I'm not understanding. But once you have understood it now, it's like cakewalk. So the entire pharmacology can be compacted in just 20 pages by making these master charts. 90% of pharmacology we are covering here like this. But unfortunately, I don't have time to cover all the 20 charts. But in this session, I will try to cover 5 or 6 of them. And now the most high yielding from which maximum MCQs come. So can we go ahead? This is the plan. This is the strategy. This is the way I teach pharmacology. Okay, it is unique. It is different, but it is having better retention, I can assure you. Okay. So chalo, coming on the question. Okay, now this is a bacteria. Everyone have a look on the screen. This is a bacteria. This bacteria is present in my patient's body. I'm a doctor. I'm having a patient in my clinic. My patient is having certain infection. In my patient's body, this bacteria is present. So I want to treat my patient. So I want to kill this bacteria. If the bacteria get killed, the patient will be getting cured, getting treated. I want to kill this bacteria. There are 4 mechanisms I can kill this bacteria. How can I kill this bacteria? Number 1, there are certain drugs which inhibit the cell wall synthesis in the bacteria. The cell wall synthesis is inhibited. The bacteria will be dead. Okay, no cell wall. It will rupture. It will be dead. Okay, so here basically penicillins will come. There is a question on penicillin also. I will come on that. Okay, the second, there are certain drugs which causes holes in the cell membrane, not cell wall. They are causing the holes in the cell membrane. Once there are holes or pores in the cell membrane, the cytoplasm will leak out. The bacteria will be dead. Okay, this is the second mechanism. The third mechanism, which is our question right now, there are certain drugs which go and inhibit the ribosome. Once they inhibit the ribosome, no protein synthesis, because protein synthesis takes place on the ribosome. No ribosome. In the ribosome, there is 30S unit and 50S. So some act on the 30S, some 50S, some both. I will tell you. Okay, so these are protein synthesis inhibitors. And the fourth and the last, there are certain drugs which inhibit the nucleic acid synthesis. DNA and RNA synthesis, and they kill the bacteria. So these are the 4 mechanisms. Among the 4 mechanisms, currently I'm teaching you these drugs. The drugs which inhibit protein synthesis in the bacteria. Say yes. Got it? Can I start the drugs? So I will teach you 4 drugs here. There are 4 drugs which act by this mechanism. Okay, so what are the 4 mechanisms by which we can kill a bacteria? Inhibit the cell wall synthesis. Okay, there are certain drugs. The drugs which cause pores in the cell membrane, the second mechanism. The drugs which inhibit the ribosome, the third mechanism. And the drugs which inhibit the nucleic acid. So it is a simplified way you can understand. Okay, got it? Is the speed is the fast? I thought you have already read all this. I'm just brushing up your concept. Are you reading fast time? Or is the speed is still fast you find? Huh? Or is it good to go? Is it good to go? Okay, I will be a little bit slow. Okay, so listen, before understanding the 4 drugs, I will teach you 4 drugs. I will teach you tetracycline, chloramphenicol, tetracycline, chloramphenicol, streptomycin, aminoglycoside. I mean, streptomycin is one of the aminoglycoside, and erythromycin. So these are the 4 drugs. All of them act on the ribosome. They all act on the ribosome. They all inhibit ribosome. They all inhibit the protein synthesis by inhibiting the ribosome, but different step. Different steps. So first you have to understand the normal steps. Okay. Have you read transcription and translation in biochemistry or in your school? Huh? Have you read it? Have you read it? Huh? So we will just quickly see the normal steps. If you don't know the normal, I will tell you which step is inhibited by which of them. So first see normal, how this bacteria synthesize protein. See, this is a bacterial cell. Please, this is bacterial cell, not human cell. Can you see the bacterial cell? Say yes. Inside which this is the nucleus. Nucleus of the bacteria. Inside which this is the DNA of the bacteria. You can see a bacteria, the nucleus of the bacteria, the DNA of the bacteria. Okay, the 2 strands of the DNA get separated. One is leading, one is lagging. So the 2 strands of the DNA get separated. One is leading strand, one is lagging strand. On the leading strand, the mRNA gets synthesized. Can you see this is mRNA? This is mRNA. It is getting synthesized on the leading strand in the nucleus. This step is known as transcription. What is it known as? This step is known as transcription. Transcription is formation of mRNA from DNA. This step is transcription. Now this mRNA will move out in the cytoplasm and go to the ribosome in the next. Now this mRNA is coming out. It is already going to the ribosome and binding on the ribosome. It is binding on the ribosome. Now on the ribosome, protein synthesis will take place. And this is known as translation. In translation, the protein is formed from mRNA. So first from DNA, mRNA is formed. And this mRNA comes in the cytoplasm and protein, the chain of amino acid is formed. This is transcription, this is translation. This is how protein synthesis takes place. So all my 4 drugs, I'm teaching you 4 drugs. Tetracycline, chloramphenicol, aminoglycoside, and erythromycin. They all inhibit translation, the different steps of the translation. Now, can you see a ribosome? In the ribosome, we are having 2 windows, P window and A window. So on the next page, I'm zooming the ribosome. Can I zoom the ribosome? This is a ribosome, you can see. Okay. So you can see this is a ribosome. You can see this is P window. Okay, and you can see this is A window. We are having a P window, we are having a A window. This is 30S of the ribosome, this is 50S of the ribosome, 30S and 50S. So when this mRNA is coming out, it is binding like this. On the mRNA, we are having codons. So first codon, the triplet, the first codon always go on the P window. And the second codon always go on A window. It's a rule. Okay. Now each codon stands for 1 amino acid. There are 20 amino acids, So different codons, you have read it. They are standing for different amino acid. Okay. Now this is the bacterial cell. You can see. On the bacterial cell, the ribosome you can see. On the ribosome, mRNA you can see. The first codon is on the P window. So there is a call. For example, on the P window, there is AUG. AUG stands for methionine. So wherever is the methionine, it will come and bind here. So second is whatever it is, whatever amino acid, it will be jahan pe bhi hoga, wo aayega. So the first P window is calling ki AUG ke liye kaun stand karta hai? Who's standing for AUG? Please come here. So methionine is raising hand. Yes, I am standing for AUG and I am coming. So for the transport, tRNA are there. All these 20 amino acids present in the cytoplasm on tRNA. It is for transport. Transport RNA. All the 20 are present. So one by one they will come. Now let me tell you the 4 steps. Please see. The first step. Can you see? So whatever the first codon, the corresponding amino acid will come and bind on the P window. This step is known as initiation. Please learn. Say yes. The first step, initiation. It takes place on P window. Now the second step, whatever amino acid which is standing for C2, the second codon, it will come and bind on the A window. This step is the second step. That is binding of the new. This is old and this is new. This is old amino acid tRNA. This is new amino acid tRNA. So old come on the P window, because don't say old, say the previous. The previous one come on the P window and the new one always come on the A window. So step 1 is on P window and step 2 is on A window. I will tell you 4 steps. Now what will happen? There is peptide bond formation in the next step. This is pre-existing, this is new. So peptide bond formation between the two. The third step. The 2 amino acids are binding together. Peptide. And the P will shift to A. I mean the previous will go to the new one. New will not come to the previous. You can see the arrow. The previous is shifting on the new. See, it will be like this. So it is P to A shift. So the third step is P to A. First step is on P window. Second step is on A window. The third step is P to A shift. It's P to A. The amino acid present on the P is moving to the A. Say yes, people. Say yes. Got it? Got it? And the fourth and the last, listen, the complete ribosome will move ahead by one codon. Ribosome chal ke jayega, ek codon aage. So the P window will come on A window. C1 will be empty. P window will come on at the place where A window is. A window will move to the C3. A window will move to the C3 and C1 will be empty. Got my point? But the chain of amino acid will remain there only. So currently the chain of amino acid is on A window, but now the ribosome is moving. So at the place of A, the P will come. So it is A to P shift. The chain is shifting from A to P. You are getting C here. The C1 is empty. The complete ribosome is moved by one codon. So P, which was there on C1, now moved to C2, and A, which was there on C2, moved to C3. So one ribosome is moving by one codon. It is known as translocation, the last step. It is known as A to P. So we are having 4 steps. What are the 4 steps? The first step takes place on P window, the second on A window, the third is P to A shift, in which the pre-existing amino acid is shifting to the new one after forming peptide-peptide bond. And the last one is A to P shift, which is translocation, in which the complete ribosome is moving by one window. Listen the summary, everyone, listen. Aminoglycoside inhibits step 1. Aminoglycosides, okay, inhibit step 1, they inhibit P window. Tetracycline inhibit A window, that is step number 2. Tetracycline, which is our question right now. Tetracycline inhibit A window, right? Say yes if you got it. The third one, chloramphenicol inhibit this step. Chloramphenicol, it inhibit P to A shift. It inhibit the peptide-peptide bond formation and pre-existing to new shift. And finally, erythromycin, that is macrolides, it inhibits A to P shift. How many of you got it? The 4 mechanism of action I taught you in one shot. See, I'm showing you all 4 here. So this step, the P window, the first step, it is inhibited by tetracycline. Let me use a highlighter. This step is inhibited by tetracycline. Tetracycline inhibit P window, number 1. The second step, this is, I'm really sorry. This step is inhibited by aminoglycoside. A, A is the first letter in ABCD alphabets. So A inhibit the first step. This is how I learn. Aminoglycoside inhibit the first step, initiation. The second step is inhibited by tetracycline. The third step, P to A shift. It is inhibited by chloramphenicol. And the last step, A to P, it is inhibited by erythromycin. I hope you all are got it. Say yes if you all got it. So I taught you the mechanism of action of all 4 drugs together in one shot. Okay, got it? So mechanism of action of all 4 is done. Say yes. Tetracycline, chloramphenicol, aminoglycoside and erythromycin. So in our one question, I have shown you one question. Many questions I am covering together. It is not that particular question I am just covering and moving to the next one. No. So we are covering many questions together. Got it? Can we go ahead? So this is the mechanism of action we have seen. Of all 4 we have already seen. You want me to fill this table? It will again take another 10 minutes. So I taught you the mechanism of action of all 4. Mechanism of action already done. Now I want you to learn the adverse effect and uses of each of them. There are 8 mnemonics. 1111 for adverse effect and 1111 for uses. So I'm having 8 mnemonics. With the help of mnemonics, you can learn the adverse effect and uses of all these 4 drugs. Say yes if you all got it. Say yes. Okay. So you want me or you will read it? I will provide the PDF. So you just learn the mnemonics of these all. You just learn the mnemonics. Mechanism of action already done. You want me to take it quickly? Okay. So let's start with the tetracycline. I will be a little bit on the faster mode because it's a mnemonic. There is nothing to understand. The part which was conceptual, I already explained you the mechanism of action of the 4 drugs. So let's start with the first one, tetracycline. Tetracycline is known as tetracycline because it is having 4 benzenes. That's why tetra. It is having 4 benzene rings. That is the introduction you can see. Classification, there are 7 types of tetracycline. You can read the classification. I will provide you all the classifications at one place. You can read the complete classification. There are 7 types. Tetracycline, chlorotetracycline, oxytetracycline, demeclocycline, doxycycline, minocycline, lamicycline. So all of them are cycline. Learn the 7 types, all 7 together. Okay, spectrum. They kill all gram-positive cocci, gram-negative cocci, gram-positive bacilli, gram-negative bacilli. They kill all bacteria. They are broad spectrum. Mechanism of action I already taught you. They inhibit step number 2. They inhibit A window, not P window. So mechanism of action, they inhibit the A window. That is step number 2. And they act on the 30th of the ribosome. Adverse effect, the mnemonic is in front of you. The adverse effect mnemonic is, LK Advani is PT teacher. L stand for liver damage. K stand for kidney damage. Liver damage, patient have jaundice. Kidney damage, patient have nephritic syndrome. Okay. A is anti-anabolic effect. D is diabetes, not diabetes mellitus. It's diabetes insipidus. Okay. V is vestibular toxicity. You know, inside the ear we have vestibules. No? The vestibules are the 3 semicircular canals. The patient will be having vertigo and all. So vestibular toxicity. I is intracranial pressure is raised. Intracranial pressure is raised. P is phototoxicity. Whenever the patient will go in the sunlight, the patient will have rashes if the patient have taken a tetracycline. Okay. T is teeth and bone. The tetracycline get formed chelates with the calcium. That is teeth and bone में chelates बनाएगा. And one more T is teratogenic. Okay. So let me write L K अडवी. अडवानी को अडवी बोल दो. अडवी. L K अडवी. P T teacher. Say the full form. Say. So liver damage, kidney damage, anti-anabolic effect, diabetic insipidus, vestibular toxicity, the vertigo, increase intracranial pressure, phototoxic, teratogenic, and teeth and bone. So this is how I learn, and I never confuse, and you get questions on that. So we are done with the adverse effect. I will write it here. What about the uses? So learn the uses. Tetracycline is drug of choice. The first drug of choice. Tetracycline is drug of choice in all these infections. How to learn these infections? I'm having a pneumonic. The pneumonic is vacuum the bedroom. Vacuum the bedroom. Vacuum may use only one U. Don't use W. So V for Vibrio. A for acne. You know acne, pimples. Okay. C for chlamydia. LGV, है ना, lymphogranuloma venerum, which is caused by chlamydia. U is ureoplasma, M is mycoplasma, bhai. Ureoplasma, mycoplasma. T is tularemia. Tularemia is plague. And B, R, bad room. B is Borrelia, R is rickettsia. Say it. Vacuum. Only one U. The bad room. Say. So this is the uses of tetracycline. This is how you have to learn. Say it. Vibrio, acne, क्लमाइडिया में एलजीवी के लिए ड्रग ऑफ चॉइस है. यूरियोप्लाज्मा माइकोप्लाज्मा के लिए ड्रग ऑफ चॉइस है. टुलुरेमिया दैट इज प्लेग के लिए ड्रग ऑफ चॉइस है. बोरेलिया एंड रिकेट्शिया, ऑल द रिकेट्शिया. Say yes. So this is how you have to learn. So complete tetracycline chapter in just 5 minutes. Rather just 2 minutes you can revise. Complete tetracycline. Complete. Coming on the next chapter, chloramphenicol. Quick. So chloramphenicol here, only one benzene ring with a nitro moiety is there. Don't learn the structure. Just for your knowledge, I'm telling, there is no classification. Only one drug, chloramphenicol. Tetracycline, we have 7 type of tetracycline, but here only one drug, chloramphenicol. Spectrum is same. It's same. It is also broad spectrum. Kill all 4 bacteria. Gram-positive cocci, gram-negative cocci, gram-positive bacilli, gram-negative bacilli. All 4 are get killed here. है ना? Mechanism of action, it inhibits the third step. Third step is P2A. P2A, if you remember, yes, it's P2A shift. The previous one to the new one. Peptide bond formation between the two. Peptide bond formation between the pre-existing and the new, and shifting of pre-existing over the new. So that is P2A shift. So it is inhibiting P2A by binding on 50S of the ribosome. This was binding on 30S. This is binding on 50S. This is inhibiting A window. That is step number 2. And this is inhibiting the peptide bond. That is step number 3. So step number 2 is gone. Step number 3 is gone. Say yes. Spectrum is same. Now the 2 mnemonic, adverse effect and uses. What are the adverse effect? The adverse effect mnemonic is big, super, hyper. The adverse effect is big, super, hyper. Big B stand for bone marrow depression. You know, inside the bone marrow, humans have hematopoietic stem cell. Do you know that? Humans have hematopoietic stem cell in the bone marrow that synthesize RBC, that synthesize WBC, and that synthesize platelet. So basically, if this is my patient's bone marrow and I am giving chloramphenicol to my patient. Chloramphenicol inhibit hematopoietic stem cell. So no RBC synthesis, no WBC, no platelet. Patient have pancytopenia. This is a very deadly, severe side effect. Patient have anemia. Patient have bleeding because of thrombocytopenia, and patient have high susceptibility of infection because of leukopenia. So we do not give this drug. Nowadays, chloramphenicol is hardly or rarely used, only in restricted use. It is banned. Most of the parts it is banned. So we don't use because it is a very severe side effect. Bone marrow depression. I is irritative. Once you give the oral tablet, patient have vomiting. If you give the injection, patient have pain. So whatever route you are giving, patient have irritation. Okay, I is irritation. G is gray baby syndrome. It's a very important MCQ. Gray baby syndrome is caused by, answer is chloramphenicol. Super is super infection, hyper is hypersensitivity. So big, super, hyper. And the uses, it's very restricted use. We don't give chloramphenicol if alternate drug is available. Chloramphenicol is not a drug of choice of any of the infection. If the first drug or second drug is not working, then we use chloramphenicol. The uses are restricted. So the mnemonic is Bayer TB. B stand for bacterial meningitis. A for anaerobic infection. R for rickettsia. Rickettsia, the drug of choice is tetracycline. I told you, in tetracycline bedroom ka BR, R is rickettsia. If it is not treated with tetracycline, then we try chloramphenicol. It is not drug of choice. E is ear and eye infection. T is typhoid, B is brucella. So please learn. So here big super hyper and bare TB. Say yes. See, LK Advi is a PT teacher and vacuum bedroom too. Here big super hyper and bare TB. You want me to say it again or you got it? Say yes. Say yes. Okay. Can we go ahead? Huh? Okay, what Dr. Pradeep, what you are saying? Ma'am, stop at means I didn't got it. Okay, so this is the second chapter. We are done. In the next 2-3 minutes, we are going to finish aminoglycosides. So let's come on aminoglycosides. Aminoglycosides, the classification you have to learn. There are questions on aminoglycoside. None of the aminoglycoside is oral. No. It is not available oral. Either it is available in the form of the injections, that is parenteral, systemic or parenteral, or it is available in the form of the ointments and tubes and eye drops. So it is known as topical. So either injectable or topical. The injectable are 8 and topical are 2, total 10 are there. 8 plus 2, total 10. You have to learn. The injectable, I am having a mnemonic. The mnemonic is STANGS KP. Or you can learn STANG. STANGS. STANGS KP. S for streptomycin. T for tobramycin. A for amikacin. Okay. N is for netlimycin. G is for gentamicin. One more S for cesomycin. K for kanamycin and P for paramomycin. Okay, all of them are mycin. But 2 topical you have to learn. Neomycin and framycin. So you get a question which of them is topical, which of them is systemic. Say yes if you got it. Okay, can we go ahead? So learn all the classifications together. Spectrum is very important. Here it was broad spectrum killing all 4 bacteria. It was also broad spectrum killing all 4 bacteria, but it is very narrow spectrum. It killed only gram-negative bacilli. Not gram-positive cocci, not gram-negative cocci, not gram-positive bacilli. Among the 4 categories, it killed only gram-negative bacilli, that too aerobic. Strict aerobe, obligate aerobe. So spectrum is very narrow. You get questions on that. Mechanism of action, it inhibits the step number 1. Step number 1, that is initiation. It inhibits P window. It is inhibiting P window. So this one was acting on 30S. You get a question on that. This one act on 50S. You get a question on that. This one act on 30S as well as 50S as well as junction. You get a question on that. This one is inhibiting A window, that is step number 2. This one is inhibiting P2A shift, that is step number 3. This one is inhibiting P window. P window, that is step number 1. Okay, so please learn that. Now the mnemonic for adverse effect and uses. The mnemonic for adverse effect, I already told you for streptomycin, on HT. It is ototoxic, the person becomes deaf. Okay, nephrotoxic, neurotoxic. H is hypersensitivity, that is allergy, and T is teratogenic. Never give aminoglycoside to any pregnant lady. It's teratogenic. So on HT. And uses, I don't have any mnemonic unfortunately here. It is used for all gram-negative bacillus infection. I told you it is effective only for gram-negative bacilli. So all the gram-negative bacillus infection we give it. And we give it in TB also. In TB, the 5 drugs I told you, H, R, Z, E, S. The S is aminoglycoside. Okay, so it is used in TB also. Okay, the last drug I am teaching you is erythromycin. Can I continue? The last drug is on erythromycin. Okay, the advertisements are not in my hand. Come on, how can I control the advertisement? Listen. So coming on the erythromycin. Erythromycin, it is one of the macrolide. Macrolide is such an antibiotic which is having macro structure, multiple big rings. That's why it is known as macrolide. Don't learn the structure. We can skip this one. Don't learn the structure. Okay, there are 5 macrolides. Okay, erythromycin, roxithromycin, clarithromycin, azithromycin, and spiromycin. The most important here is the drug of choice. The important prototype drug is erythromycin. Okay, but you have to learn all the macrolides. One of them is erythromycin. Now see the spectrum. See. There are 4 types of bacteria. Everyone on the screen. There are 4 types of bacteria. What are the 4 types of bacteria? Say, ma'am, gram-positive cocci, gram-negative cocci, gram-positive bacilli, gram-negative bacilli. So tetracycline was effective for all of them. Chloramphenicol was also effective for all 4 of them, but aminoglycoside has done a partiality. It was killing only gram-negative bacilli, not other 3. So other 3 ko bura lag gaya. The other 3 were feeling bad. Ki aminoglycoside is not killing us. We are bad. Why aminoglycoside is not acting on us? So erythromycin is acting on those 3. Except gram-negative bacilli. Erythromycin act on gram-positive cocci, gram-negative cocci, and gram-positive bacilli. This is the simplest way you can learn. Okay. What is the mechanism of action? It inhibiting last step. Step number 4, translocation, in which the ribosome is moving by 1 codon. So it is A to P shift. It is inhibiting A to P. So now please open your eyes and learn the ribosomes, which segment of ribosome it is acting. You get questions on that. Now tell me the last two mnemonic, the uses and adverse effect of erythromycin. We will pack the chapter. So adverse effect, the mnemonic is macro. What is macro? It is a macrolide, no? The mnemonic is macro. M is motilin receptor agonist. You know, in our esophagus and intestine, we are having certain receptors which are known as motilin receptors. Erythromycin is an agonist for that. Once the motilin receptor get active, na, it causes paralysis, patient have diarrhea. So one of the adverse effect is diarrhea because of motilin receptor agonist. Number one. A is allergy. Hai na? C is cholestasis, that is jaundice. Patient will have jaundice. And RO is reversible autotoxicity. So we have autotoxicity in aminoglycoside also on HT. Hai na? On HT ka O hai. But here it is reversible. That was irreversible. And the uses is CLAW. CLAW. C is chancroid and corynebacterium diphtheria. L is legionella. A is atypical pneumonia and W is whooping cough. This is the best way I can teach you the 4 chapters in just 15-20 minutes. And I guarantee you, I mean, most frequently you get questions from them. I can't guarantee which one, but definitely you are going more. There is high chances you will get a question from this master table. So second master table we have completed together. I taught you now I'm having nearly 15-20 the master tables in the pharmacology in which I have compacted entire pharmacology like this. I don't revise from the book. I just revise my master table. Now I have understood it. I can revise it very quickly. I know the full forms. I know everything. So all the drugs you compact like this in the pharmacology. This is the way to study pharmacology. Say yes. Are you liking it? Say yes. Can we go ahead? Can we go ahead? Okay. Yes. So this is the way you have to study. So please see. So we are done with this. Okay. So let me skip the next few questions and come on the next question related to this. Let me skip. And let me come on the next topic. Okay. The next question. Okay. Next question is in front of you. So the next question you can read. Tell me the answer. Read the next question. Which of the following is a side effect of sulfonamide? The 4 options are in front of you. Is it constipation, joint pain, crystalluria or hyperkalemia? What is the correct answer? Can you tell me the correct answer here? First you guess, then I will tell you the correct answer. The third master table we will make. I will try to give you maximum master tables today so that your pharmacology can be compacted as much as you can. So we will discuss few questions, but based on in each question, I'm telling you 20, 20, 30, 30 questions. Okay. Got it. What is the correct answer? The correct answer is crystalluria. So you have to understand what is sulfonamide. I will come on the question again. Don't worry. But first you have to understand what is a sulfonamide. I told you this is a bacteria. To kill this bacteria, just a second. I can't see my video. Just a second. To kill this bacteria, there are 4 ways. What are the 4 ways to kill this bacteria? Now, this bacteria is present in my patient's body. I'm a doctor. I want to treat my patient. So if I want to treat my patient, I want to kill the bacteria. Obviously, I want to kill the bacteria. So how can I kill this bacteria? You see, ma'am, there are 4 ways by which you can kill. Number 1, there are certain drugs which inhibit the cell wall synthesis. Okay, that is especially the penicillins. Okay, beta-lactam antibiotics. So the cell wall synthesis inhibitors. The cell wall gets synthesis inhibited, the bacteria will die. The second, there are certain drugs which cause holes in the cell membrane. Okay, the cytoplasm will leak out and the bacteria will be dead. There are certain drugs which inhibit the protein synthesis by acting on the ribosome. We have already studied these 4. Which 4? Tetracycline, streptomycin, aminoglycoside, erythromycin, and the 4th one, you know, chloramphenicol. These 4 we have already seen that. Now the last one, there are certain drugs which inhibit nucleic acid synthesis. Sulfonamide is one of them. So currently I am teaching you the drugs which inhibit nucleic acid synthesis. So I already taught you the 4 drugs which inhibit protein synthesis. Which 4 you know that? Hana? Now I am teaching you the 3 drugs which inhibit nucleic acid synthesis. I taught you the 4 drugs which inhibit protein synthesis. And now I am teaching you the 3 drugs which inhibit nucleic acid synthesis in the bacteria. The 4 drugs which inhibit protein synthesis is tetracycline, chloramphenicol, aminoglycoside, and erythromycin or macrolide. Here I will teach you 3 drugs: sulfonamide, trimethoprim, and quinolones, the fluoroquinolones. I will teach you 3 drugs here. So basically, first you have to understand which drug is killing the bacteria by which mechanism. And then you have to understand the conventional, the mechanism of action of them, the uses, the adverse effect. For uses and adverse effect, I will give you maximum mnemonics. Pharmacology is full of mnemonics. But once you have understood it now, it will be very, very easy. Okay. Got my point? Okay, so yes, Gaurav, I can take it if the team allows, because there are back-to-back many sessions now. We don't have any empty slots somewhere. If I found it, I will definitely coordinate with the team and take few more sessions for you. Okay, but maximum important high yielding topics I'm trying to cover in a limited time. Thank you so much for your feedbacks, for your compliments. Thank you. So, okay, each and every second is worthy listening. Okay, so don't waste whatever I'm saying. It is having a worth in that. Anyways, so let's move ahead. So I'm teaching you 3 more drugs. The third master table I'm teaching you right now. Okay, the third master table we will see. So I'm teaching you 3 drugs: sulfonamide, trimethoprim, and quinolones. These headings are common for me. Hana, these headings are common. Hana, only the drug will keep on changing. All these 3 drugs do one thing. They inhibit nucleic acid synthesis. Okay. Now listen, this is the bacteria. This is the nucleus of the bacteria inside which this is the DNA. Okay. So these 3 drugs inhibit the DNA synthesis. Out of the 3 drugs, I'm teaching you 3 drugs now. Out of these 3 drugs, the first two, sulfonamide and trimethoprim, they inhibit DNA synthesis indirectly. But the third one, quinolone, it inhibits the DNA synthesis directly. You will say, ma'am, what do you mean by indirect and direct inhibition? What do you mean by that? What is indirect inhibition and what is direct inhibition? So basically, quinolone directly inhibit the DNA synthesis. One of the step. I will tell you which step. But sulfonamide and trimethoprim do not inhibit DNA synthesis. They basically inhibit folic acid synthesis. They inhibit folic acid synthesis, and folic acid is required for DNA. So they are not directly inhibiting DNA synthesis. They are inhibiting one of the intermediate. The intermediate is folic acid. No folic acid, no DNA. So these two are indirect inhibitor. So basically, sulfonamide and trimethoprim are inhibitors of folic acid synthesis, which is required for DNA synthesis. So these two are indirect inhibitor, but quinolone directly inhibit DNA only. Okay, it is not inhibiting the intermediate. Say, got it? Can we go ahead? So this is how these are the 3 antibiotics which inhibit nucleic acid synthesis. Okay, so first let's take these 2. Let's fill this table for these 2. Then come on the third one, quinolone. In the end, we will see the complete table. So sulfonamide and trimethoprim. Sulfonamide have a classification. There are many types of sulfonamide, I will tell you. But trimethoprim don't have any classification. It's only one drug, trimethoprim. Okay, so sulfonamide, these are the various types of sulfonamides in front of you. I request you to learn all classifications of entire pharmacology. I request the students. So there is a PDF which contains all the classification at one place. You can take that PDF and just read the classification. Because in your exam, if you are getting a question and you don't know that particular drug on which the question is based, that particular drug is belonging to which category, you are gone. Whatever is the question, you cannot attempt that. But tumhe pata hi nahi hai, if you don't know sulfonamide is a nucleic acid synthesis inhibitor, how you can solve the question? You're getting my point. The first thing, the foremost thing, in pharmacology is learning the classification. So please learn the classifications together. This is the classification of sulfonamide. Trimethoprim don't have any classification. The mechanism of action of both of them is shown here. You tell me, how does folic acid get synthesized? This is folic acid. The folic acid gets synthesized from PABA. PABA. What is PABA? Para-amino-benzoic acid. What is PABA? Para-amino-benzoic acid. Got it? PABA get converted to dihydrofolic acid, and dihydrofolic acid get converted to tetrahydrofolic acid, which is the mature folic acid, main folic acid. Got it? And it is required for DNA synthesis. So for the 2 steps, there are 2 enzymes. For conversion of PABA to DHFA, the enzyme is folate synthesis. And for conversion of dihydrofolic acid to tetrahydrofolic acid, the enzyme is dihydrofolate reductase. Dihydrofolic. This is folate synthetase. This is folate reductase. Okay, the 2 enzymes. So see the 2 drugs. Sulfonamide. I'm teaching you the first 2 drugs. These 2 drugs. Sulfonamide inhibit the first enzyme. Trimethoprim inhibit the second enzyme. Sulfonamide inhibit folate synthetase, and trimethoprim inhibit folate reductase. So both of them inhibit folic acid. No folic acid, no DNA. So both of them are indirect inhibitor of DNA synthesis. How many of you got it? Is the speed is good? Everything is good? Kindly give the feedback. I cannot see you people. I can see what is your chat. That's the only thing we can communicate with each other. Okay, so you can imagine. So whatever is your concern, whatever is your feedback, kindly write on here. Everything is good. The speed is good. The content is good. You are learning. You are enjoying. Everything is good. Can we go ahead? Okay. So these are the 2 enzymes which are inhibited by the 2 drugs. Okay. So that's why sulfonamide and trimethoprim, we give them in combination. So we give a drug which contain both of them, because these both drugs are inhibiting one enzyme in the same sequel. So if we give the combination of both, there are more chances that folic acid is completely inhibited. If you are giving only sulfonamide, maybe it is synthesized by some other mechanism. If you are giving only a trimethoprim, maybe it is synthesized by some other mechanism. But if you are giving the combination, there is no way folic acid is going to be synthesized. No folic acid, no DNA. So the combination is known as cotrimoxazole. Cotrimoxazole. What is the combination known as? The combination is known as cotrimoxazole. So cotrimoxazole is a drug which contains sulfonamide and trimethoprim. It contains sulfonamide and trimethoprim in a ratio of 5:1. It's a question on that. So what is the ratio of sulfonamide is to trimethoprim and cotrimoxazole? It's 5:1. So just suppose this is a tablet of cotrimoxazole. How much sulfonamide it contained? 5 times as that of trimethoprim. Whatever is the concentration, it's 5:1. So learn 5 is sulfonamide. How to learn sulfonamide and trimethoprim? So we write S like this, and 5 like this. So you can learn 5:1. You will never forget 5 is sulfonamide and trimethoprim T is 1. Okay, so it's 5:1. Don't do the reverse. If they ask you what is the ratio of trimethoprim is to sulfonamide, answer will become 1:5. So you have to learn that 5 is sulfonamide. You have to learn. Okay, in that tablet. Just suppose I am taking a tablet of Cotri. This is a tablet of Cotri. I am taking it with water. So this tablet contains 5:1 sulfonamide is to trimethoprim. After going into my body, it will get absorbed. It will go in my blood. In my blood, the ratio will become 20:1 after taking because of different volume of distribution of the two drugs. So once we take it, it's 5:1. But after going, in the blood, it is 20:1. So you have to learn this is cotrimoxazole. Now tell me the adverse effect of the two drugs. What are the adverse effect of sulfonamide? Tell me a mnemonic. What are the adverse effect of trimethoprim? Tell me a mnemonic. The uses of both of them is same because we don't use them individually. We use the combination. So this is the uses of Cotri. This is the use of cotrimoxazole. So we don't use them individually. So uses are same. Uses are same. So I'm going to give you 3 mnemonic. One for adverse effect of sulfonamide, one for adverse effect for trimethoprim, and one for uses of both of them. We use them together. That's why for uses we have only one mnemonic. Say yes if you got it. So the adverse effect of sulfonamide, the mnemonic is ABC of fresh. What is the mnemonic? The mnemonic is ABC of fresh. A stands for aplastic anemia. B stand for bilirubin displacement. In the blood, bilirubin is there. This is a blood vessel and this is the bilirubin. We all have bilirubin in the blood. Bilirubin bind with the albumin. It is conjugated bilirubin. It is bind. So once I am taking, just suppose I am taking sulfonamide. So sulfonamide will go in the blood. It will get absorbed. Sulfonamide bilirubin ko dhakka marta hai. It will displace bilirubin and himself bind with the albumin because it is having more affinity for albumin as compared to bilirubin. So bilirubin will become free. Free bilirubin will go in the brain, damage the brain and cause kernicterus. It will cause kernicterus by damaging the basal ganglion there. Okay, so this is how it causes kernicterus. I told you the mechanism. C is crystalluria, which is our question right now. Our question is right now on crystalluria. R is rash. A is acetylation. S is SLE. And H is hemolysis in G6PD deficiency. I know mnemonics are difficult and I'm just bombarding on you. But you can understand, we can learn pharma with the help of mnemonics only, especially the uses and side effect. The mechanism of action I am explaining you, but uses and side effects, no other way to learn. Okay, this is the best way you can learn. This is the adverse effect of sulfonamide. Now tell me the adverse effect of trimethoprim. Again, I am having a mnemonic. Bus from New Mumbai to Kolkata. So bus, B for bone marrow toxicity. There is one more drug I told you the bone marrow toxicity. Which was that? Big super hyper chloramphenicol. So it is also causing bone marrow hypersensitivity like chloramphenicol and it is causing pancytopenia. That's why in 5:1 this is only 1. We are not increasing the concentration because it causes bone marrow toxicity. N for nausea and vomiting. M for megaloblastic anemia. T is for teratogenic. There are many drugs which are teratogenic. And K is kalemia ka K. Potassium. It is increasing the potassium. Hyperkalemia. It's causing hyperkalemia. It increases the potassium concentration in the blood, which can lead to arrhythmias. Okay. So this is the mnemonic. And the uses of both of them is Septron. Cotrimoxazole, the brand name of the tablet is Septron. Like paracetamol is available as Crocin. Crocin is a brand name which contains paracetamol. In the same way, Septron is a brand name. It's very famous like Crocin only. In which cotrimoxazole is present. So cotrimoxazole ka mnemonic is Septron. Okay, Septron. S stands for STDs. It is first choice drug for the STDs. E for anthritis. P is Pneumocystis carinii and Pneumocystis jeruvari, the pneumonias. T is for typhoid. R is respiratory tract infection. A is actually U है वो. You can make U also. UTI, acute UTI. N is nocardia. So this is the 2 we have completed. So tell me, sulfonamide inhibit folate synthesis enzyme, the first enzyme, and trimethoprim inhibit folate reductase enzyme, the second enzyme. Ultimately, both of them are inhibiting the folic acid synthesis. Ultimately, no folic acid, no DNA. So ultimately, both of them are indirect inhibitor of nucleic acid. Okay, here the adverse effects are ABC of rash, and here the adverse effects are bus New Mumbai to Kolkata. And the uses of both of them is Septron. I wish if I could have time and I can repeat the full form of the mnemonic. Say yes. Okay, say yes if you got it. Can we go ahead? Can I tell you the third drug? The last drug here, quinolones. Can I tell you the third one? The last one, quinolones. So let's come on the last one, quinolones. Quinolone also inhibit DNA, but not indirectly. It is not a folic acid synthesis inhibitor. It directly inhibits the DNA synthesis. It's a direct inhibitor. So can I come on the quinolones? So let's start quinolone with the help of a question. Now read the question and tell me the answer. Read the question. Which of the following fluoroquinolone has broadest spectrum against the bacteria? Your options are ciproflox, norflox, provaflox, and nalidixic acid. What is the correct answer here? Can you tell me what is the correct answer? First give a guess, then I will give you the correct answer. Tell me, what is the correct answer? Here's the correct answer is provaflox. They are asking broadest spectrum. So basically there are 4 types of quinolones. Learn the classification. There are 4. I'm teaching you quinolone. How many types of quinolones are there? There are 4 types of quinolones. First generation, second generation, third generation, and fourth generation, depending on their activity against the bacteria, depending on their activity. First generation kill only gram-negative bacteria, few gram-negative bacteria. So in first generation, there are only 2 drugs, nalidixic acid and oxalic acid. We don't use them. They are very narrow spectrum. They kill only few gram-negative. Second generation also kill gram-negative, but maximum gram-negative. So it increases the spectrum. So here there are 4 drugs, norflox, limoflox, ciproflox, and oflox. You can make some mnemonic. Norflox, limoflox, ciproflox, and oflox. Here we have only 2, nalidixic acid and oxalic acid. This kill gram-negative, few gram-negative. This kill maximum gram-negative, not even gram-positive. Abhi tak gram-positive nahi aaya hai. Third generation mein gram-negative are killed along with few gram-positive also. So in third generation, there are many drugs. You can learn the name. Levoflox, Parflox, Getiflox, Pflox, Temaflox, Tosnuflox, Moxiflox. And finally, you have to learn the fourth generation, which kill everything. It kill all gram-negative. It kill all gram-positive. It kill all anaerobics also. It kill everything. The broadest spectrum, which is our question. So you have to learn this list. You have to make some mnemonic and please learn this list. So it is Trovaflox, Fleroflox, Gamiflox, Proliflox, Sitaflox, and Clinaflox. So Trovaflox, Fleroflox, Gamiflox, Proliflox, Sitaflox, and Clinaflox. Can you make some mnemonic? I don't have it, unfortunately. You can make some for me also. If you have it, kindly share. So this is the list. So this is our question right now. This is the list. This is the broadest spectrum. I mean the fourth generation. In the question, they are not saying the fourth generation word, but they are saying the broadest. By broadest, you have to interpret they are asking the fourth generation, because the fourth generation is the broadest one. So which among the following is the fourth generation? I guess the ciproflox and norflox are second generation, and nalidixic acid is the first generation. Only among the option fourth generation is provaflox. So you have to learn that. You have to learn that. Got my point? Okay, got it. So it is Trovaflox. Trovaflox is the correct answer. If you learn the classification, I guarantee you, if you learn the classification, the complete classification in pharmacology, 20 to 30% pharmacology is done in the classification itself. 20 to 30% PYQs are based on classification. The next thing you have to learn is all master tables. So learn only 2 things. I learn only 2 things in pharma, all classifications and all my master tables. I told you now I'm having 20 master tables. So all the 20 chapters I have converted into 20 master tables. I just revised that. My complete pharma is done like this. Okay, it's very easy. Okay. Anyways, the mechanism of action of fluoroquinolones, all the 4 generation, first, second, third, fourth, how does they act? They all inhibit DNA synthesis. See, this is a bacteria. This is the nucleus of bacteria. Inside the bacteria, this is double-stranded DNA. Now, this DNA want to replicate. So, what are the steps of replication? Say, ma'am, the 2 strands separate from each other. The 2 strands separate from each other. And one is leading, one is lagging. One is leading, one is lagging. So this step is known as unwinding. Unwinding. The 2 steps are the two strands, the double-stranded DNA. The 2 strands are separating from each other. It is known as unwinding. Now, on the leading also, on the lagging also, DNA polymerase will come and replication will take place. वो तो बाद में. लेकिन name the enzyme which is required for unwinding. Name the enzyme which is required for unwinding. The name of the enzyme which is required for unwinding is DNA gyrase. What is the name of the enzyme? DNA gyrase. So quinolones inhibit gyrase. Quinolones inhibit DNA gyrase. Now, if I'm giving the quinolone, the DNA cannot unwind. No unwinding, no replication. So it is a direct inhibitor. It is a direct inhibitor of DNA synthesis. Say yes. So it inhibits the enzyme DNA gyrase. You can see the unwinding will not take place. No unwinding, no DNA replication, and it is a direct inhibitor. Say yes. The side effects are many. The diffuse are there. In the GIT, most common it causes nausea, vomiting. And a most important side effect in the heart, it increases the QR interval in the heart. In the ECG. Okay, it is known as torsitis de pointis. Okay, so please learn this. And the uses, it's a broad spectrum, na? 4th generation are the broadest spectrum. So the mnemonic is 4G spectrum city. 4G spectrum city. There are 4G. It is given in gonorrhea, gastroenteritis, gynecological infection, and gram-negative infection. 4G. Spectrum ka S is septicemia, P is for prophylaxis. I mean prophylaxis before surgery. Now I'm operating a patient. Hai na? I'm having before surgery, we give the prophylactic antibiotic. Ki surgery mein if the infection is occurring, so patient is having prophylactic antibiotics, so we give quinolones to the patient. So for prophylaxis before the surgery. E is enterocolitis, C is chancroid, T is typhoid, R is RTI, U is UTI, M is meningitis, C is conjunctivitis, T is TB. I know the list is extensive, people. I can understand. First time when I have heard all these lists, I was like, what is all this? But by reading again and again, you revise it 1 or 2 times only, now you will be done. You don't have to recreate and write the list. Just from the options, you have to pick it up. If you have 4 options in front of you and you know the mnemonic, just write down the mnemonic and see what is matching in the option. Okay, you will come on the conclusion. So we don't have to mug up. You have to just have a look so that you can identify in the option. उतना ही याद करना है कि option में भाई identify कर लें. हमको लिखना नहीं है पूरा बैठ के. Say yes if you got it. Say yes now, people. Say yes. Huh? Can we go ahead? So this is the 3rd master table I taught you today. Okay. So you can see the mechanism of action of all 3. See the mechanism of action of all 3. Sulfonamide inhibit folate synthetase enzyme. Okay. Trimethoprim inhibit folate reductase enzyme. And quinolones inhibit DNA gyrase enzyme. These 2 are indirect inhibitors. This one is a direct inhibitor. Okay. Here the classification I told you, 1st, 2nd, 3rd, 4th generation, especially 4th generation you have to learn. Okay. Spectrum I told you. Okay. You can see the adverse effect of all of them. See the mnemonic. See the uses of all of them. See the mnemonic. Appreciate my efforts. Appreciate. This is the 3rd master table I taught you. Appreciate my efforts. Say yes if you all got it. Can we go ahead? Haan bolo, can we all go ahead? Say yes. This is how chapter by chapter we are covering. The next question is in front of you. Read the next question and tell me the answer. What is the site of action of furosemide? What is the site of action of furosemide? What is a furosemide? First thing you should know. Furosemide is a type of diuretic. So the next chapter we are dealing here is the diuretic. We will again see some mnemonics here and important points in the diuretic. So chapter by, so we have seen many questions on the antibiotic. Now we are seeing diuretics. We will see some questions from the general also. So this is the best I can do in the 2-3 hours. Okay, got it? Okay, so it is one of the diuretic. I'm asking the mechanism of action, the site of mechanism of action of diuretic. What is a diuretic? Diuretic is a drug of choice for edema. Okay, whenever the patient is having edema anywhere on the body, edema is simply known as swelling. है ना? Patient will come to you with simply complain, doctor मुझे सूजन आ गई है. In Hindi it is known as सूजन, swelling anywhere on the body, here, there, here, on any internal or external swelling. So the drug we give, symptomatic relief drug, we give diuretics. What are diuretics? Whatever extra water is accumulated in the body that is excreted in urine. So diuretic is a drug that increases the sodium and water excretion in the water. So it increases sodium excretion in the water and it increases water excretion in the urine. Sodium and water is more excreted in the urine. So whatever extra water in the form of the swelling is there, it is excreted in the urine. So it increases the urine output. These drugs are known as diuretic. The first thing you have to understand here, and I will come on the answer. The first thing you have to understand is the classification. Bhai, classification to learn karna hi padega. है ना, कितना ही भाग लो, बट यू हैव टू लर्न द क्लासिफिकेशन. सो करना ही है तो जस्ट स्माइल और कर डालो, है ना. जो चीज करनी है उसके लिए क्या रोना, है ना. आई फील लाइक दैट कि करना है तो खुशी से कर लो फिर, ठीक है. सो डोंट जस्ट क्रिबल कि मुझे करना है ये वो, जस्ट डू इट, है ना. ऑल द क्लासिफिकेशंस एट वन प्लेस, लर्न इट और एटलीस्ट रीड इट. इफ यू कांट लर्न, एटलीस्ट रीड इट, यू कैन आइडेंटिफाई. Okay, anyways, how many type of diuretics are there? There are 3 type of diuretics, है ना. Highly effective known as high ceiling, medium efficacy and weak efficacy. High, medium, weak based on their efficacy. The high efficacy are known as loop diuretics. They are known as loop diuretics, है ना. The most important drug is furosemide. The most important drug is known as furosemide. The medium efficacy are known as thiazides. These all are thiazides. You can see hydrochlorothiazide, hydroflumethiazide, benzthiazide. These are thiazide. Medium one. And the weak one are divided in 3 category. The weak one are divided in 3 category. Carbonic anhydrase inhibitor. These are carbonic anhydrase inhibitor. These are osmotic inhibitors. And these are potassium sparing diuretics. Potassium sparing. I will call them C, P and O. C. See the classification. C. है ना. अच्छा, carbonic anhydrase inhibitor, the prototype drug is acetazolamide. You see the drug's names also, है ना. Potassium sparing, the prototype drug is amiloride or tramtarin. And osmotic में sugars are there like mannitol. See, so what are diuretics? How many type of diuretics you know? There are 3 type of diuretics. What are the 3 type of diuretics we are having? High efficacy, medium efficacy, and weak diuretics. We are having three type of diuretics: high efficacy, medium efficacy, and weak diuretics. These are the three type of diuretics. High efficacy are known as loop diuretics. I call them L. Medium efficacy are thiazides. I call them T. Hana, I'm making a mnemonic. That's why I'm giving you one letter to learn. And weak diuretics are of three type. What are the three type? Carbonic anhydrase inhibitor, I call them C. Hana. Potassium sparing diuretics, I call them P. And osmotic diuretics, I call them O. So I'm having 5 letters with me. What are the 5 letters? If I say L, you know what is L. Just a second. So I'm having L, I'm having T, C, P, O. Got my point? Now tell me they all are acting where? You will say they all are acting on the kidney. On the kidney. They are increasing the urine output of the kidney. Hana? Urine output. They all are acting on the kidney. All 5. Which 5 I taught you? All 5 are acting here. Hana? In the kidney, we have nephrons. You know, nephron is the structural and functionality of the kidney. Each kidney, human kidney, have 1 million of the nephron. Okay. So this is the diagram of a nephron. I guess everyone knows the diagram of a nephron. No need to learn. Hana? Can you tell me the sequence? The first thing we are having here is a glomerulus. This is proximal convoluted tubule. This is descending limb of loop of Henle. This is ascending limb of loop of Henle. So loop of Henle have 2 limbs, descending and ascending. This is distal convoluted tubule DCT, and this is collecting duct. Say yes. Everyone knows the sequence. Everyone. Now learn the mnemonic cold P. Hana? None of them, the drugs which I taught you 5, they act on the glomerulus. Hana? So C O L T P. This is the site of action. I mean, carbonic anhydrase inhibitors acts on PCT. Osmotic diuretics acts on descending limb of loop of Henle. Loop diuretics, which is our question right now. Right now question is loop, that is furosemide. It act on ascending limb of loop of Henle. Thiazides, all thiazides act on DCT. And potassium sparing diuretics, they act on collecting duct. How many of you got it? So the mnemonic is COLTP. Cold P is my mnemonic. My mnemonic is cold P. So what are the parts of the nephron? What are the parts? Imagine, close your eyes and tell me the parts of the nephron. सबसे पहले क्या आता है? Glomerulus, leaf glomerulus. After that, there is PCT. Imagine there is PCT, then descending limb of loop of Henle, then ascending limb of loop of Henle, then DCT, and then collecting duct. I guess everyone knows that. Collecting duct, collecting tubule. So write down COLTP. This is the site of action. You got it. Say, so carbonic anhydrase inhibitor, that is acetazolamide, act on PCT. Osmotic diuretics, that is mannitol, act on loop of Henle, descending limb. Loop diuretics, that is furosemide, which is our question right now, they act on ascending limb of loop of Henle. Thiazides act on DCT. And potassium sparing diuretics like amyloride, spironolactone, they all act on collecting duct. How many of you got it? I want a thumbs up from each and every one of you who is live here and who got the concept. Give me a thumbs up. Quick, fast, respond. Respond, people, respond. So this is the site in which you can see. So it is COLTP. This is how I learn. Kindly everyone respond. If you didn't got it, write down your doubt. Otherwise, respond that you got it. Only few students are interacting. What about others? You got it or you didn't got it? Can we move further? Can we move further? So COLTP is the mnemonic. Okay, everyone. Very good, very good. So you can solve your question now. Read the question. I'm asking for furosemide. So furosemide is a loop diuretic. Hai? So write down COLTP. They are asking for L. So what is the mechanism of action? What is the site of? This is PCT, this is descending limb, this is ascending limb. So my answer is ascending limb of loop of Henle. Ascending. If I change the same question, instead of furosemide, if I ask you mannitol. Mannitol is what? It's an osmotic diuretic. My answer will become descending limb of loop of Henle. If I change the question to acetazolamide, which is a carbonic anhydrase inhibitor, my answer will become PCT. If I give you any of the thiazide, my answer will become DCT. So you get frequent questions on that. Okay. Can we go ahead? Can we go ahead? Yes. So this is the way you have to learn the mechanism of action of these drugs. So we would like to play a game with you. Hana? Have you seen Kaun Banega Crorepati? KBC. You've seen. So there is how the participants are selected. There is fastest finger first. So I'm giving you 4 options right now. Let's play it. Okay. I'm giving you 4 options. The 4 options are in front of you. You have to arrange the 4 options based on their mechanism of action from proximal to distal part of a nephron. Do you know the diagram of a nephron? This is the diagram of a nephron. So which is acting proximally to which distally? So your 4 options are in front of you. Is it ABCD, CDBA, DBCA or BCAD? So arrange them in that order. Let me see who is the fastest finger first. So some people are saying A, some are C, some are B. What is the correct answer? What is the correct answer? Who's the first one? I guess Yash. and mad are the first one who has given the answer correctly. Fastest finger one is one only. Okay, got it? Yes, the correct answer here is this one. CDB. CDB is the correct answer. So you know the parts of the nephron you can say. So your options are in front of you. Triamterene is one of the potassium sparing diuretic. Hydrochlorothiazide is one of the thiazide. Acetazolamide is carbonic anhydrous inhibitor. And bumetanide is the bada bhai of furosemide. That is a loop diuretic. Now you can arrange. The mnemonic is C. O is not given. L, T, P. So it is CDBA. This is how you have to go. Everyone give me a thumbs up. So you get simple questions on that. Okay. So this is the thing. Okay. So one more, the next chapter. So we have seen kidney also. We have seen many type of antibiotics. Now the next chapter is the cardiovascular system. Okay. Important drugs in cardiovascular system we will see. And after that we will move on some questions on the general pharmacology. Read the question. We will solve it. Enalapril is contraindicated in all of the following except. So where enalapril is not contraindicated? Huh? Where enalapril is not, rest all are contraindication. What is the correct answer? What is the correct answer? What is the correct answer? Say yes. Yes, the correct answer is A. The correct answer is A. So let me explain you everything about the enalapril. Enalapril, first you tell me the category it is belonging. It is pril. It is pril, one of the pril. Learn the classification. It is the ACE inhibitor. So it's trying to learn everything about the ACE inhibitor. ACE inhibitor. I will tell you everything about the ACE inhibitor right now, starting from its classification. First, you will see the classification, then its mechanism of action, then its uses, then its adverse effect, then its contraindication. है ना? So here I will give you 3 mnemonics. Mnemonics के लिए the uses का mnemonic, adverse effect का mnemonic, contraindication का mnemonic. Mechanism of action as usually I will teach you in the form of the diagram. Okay, and classification we have to learn. Anna, all my drugs in my master charts are in these headings only, in which for adverse effect, uses, contraindication, I will give you maximum mnemonics. Write all mnemonics at one place. Yes. Okay, got it. So the coming on the ACE inhibitor. How many ACE inhibitors you know? What is the classification? These all are ACE inhibitor. They all have a suffix pril. They all have a suffix as pril. So it is captopril, enalapril, lisinopril, perindopril, ramipril, fosinopril, quinolopril, and tradalopril. So it is pril. Okay, don't add pril after your name. No. So you have to learn the name of the specific drug. Among them, you get a one question. Let me tell you that here only. All of them are prodrugs. They are inactive. They are prodrugs except 2. Captopril and lisinopril. Captopril and lisinopril. These are active. Hana, these are not prodrug. Except captopril and lisinopril, remaining all are prodrug. It's a very important question. Write down here only and please learn. Please learn. Now, what is the mechanism of action? So for that, you have to understand a family, the name of the family which is present inbuilt in human body, that is known as renin-angiotensinogen pathway, renin-angiotensinogen system. It's a family of few proteins and few enzymes. Let me explain you. So we all have blood pressure. What is our normal blood pressure? It's 120/80, systolic and diastolic. We know that. So my blood pressure, your blood plus minus, it is like this. So we all have a normal blood pressure. Imagine due to any reason, if my blood pressure falls suddenly. For example, I'm lying down in the morning and in the night, and in the morning I suddenly wake up. So all my blood will go to the veins of the leg, and fall in blood pressure happens if we suddenly wake up and stand. Okay, or I'm having vomiting, I'm having diarrhea, I'm having blood loss, I'm having an accident, I'm having a surgery. Due to any reason, if the blood pressure falls, what happens? God is great. Hana? God has given a physiological mechanism to restore the blood pressure, and that physiological mechanism is known as renin-angiotensinogen system. You're getting it what I'm saying? So what is that? In my blood, in your blood, in all of our blood, we have a protein. The name of that protein is angiotensinogen. The liver is forming that protein. It is currently also present in me, in you, Hana, but it is inactive, Hana. So once the blood pressure will fall, because currently my blood pressure is normal, but imagine if my blood pressure is falling, at that time my kidney will secrete an enzyme. The name of that enzyme is renin. Renin convert angiotensinogen into angiotensin 1. And ACE is another enzyme. It is secreted by lung. That convert angiotensin 1 to angiotensin 2. What is the full form of ACE? Angiotensin converting enzyme. It is you can see it now. It is converting angiotensin 1 to angiotensin 2. That's why it's known as angiotensin converting enzyme. That's why it is known as ACE enzyme. It is secreted by liver. Now this angiotensin 2 will go to 6 organs. Hana? It will go to 6 organs, I will tell you, and maintain the normal BP again. So whenever we have a fall in BP, our BP become normal within few seconds. So if I'm having like fall in BP, don't worry, in the next 2-3 seconds, my BP will be normal again, because in my body, this all will happens within the next few seconds. So it is a inbuilt mechanism. So this family, the RAS family, is having three proteins. You can see angiotensinogen, which will convert into angiotensin 1 and 2. These are the three proteins and two enzymes. The first enzyme is renin. The second enzyme is ACE. The renin is secreted by kidney and ACE is secreted by lung. And ultimately BP will be maintained again. So the five things together, the three protein and the two enzyme, it is a family, the RAS family. Renin angiotensinogen pathway family. Say yes, you can see the simplified diagram. In my blood, in your blood, we all have angiotensinogen. Say yes. The angiotensinogen is secreted by the liver. You can see from the liver, it is secreted and coming out. It is present in our blood. Now, whenever we have fallen BP, only then renin is coming. If my BP will fall, my kidney will get less blood. All organs will get less blood, but kidney is very sensitive. Inside the kidney, there are cells which are known as JJ, JG cell, juxtaglomerular cells. JG cell, juxtaglomerular cells, that will secrete renin in the blood. So as soon as the renin will come in the blood, renin convert angiotensinogen to angiotensin 1. Now from the lungs, ACE will come, angiotensin converting enzyme that convert angiotensin 1 to angiotensin 2. This angiotensin 2, okay, this angiotensin 2 will go on the 6 organs. I told you, the 6 organs. Number 1, blood pressure, blood vessels. It will cause vasoconstriction in the blood vessel. BP will be raised. It will go in the heart. It will increase the contractility. BP will raise. It will go in the adrenal and it will secrete aldosterone. The BP will raise. It will go in the kidney and increase sodium water retention. So BP will raise. It will grow in the brain and increases the ADH secretion, increases the thirst. So BP will raise, and it will go on the peripheral nerves. It will cause sympathetic stimulation. Again, BP will raise. So don't learn the organs. Acting on the 6th organ, it is maintaining the normal BP again. Everyone say yes? Huh? Okay, listen. But ACE is having one more function. This ACE. The ACE is present in the lung now. So it is coming in the blood only when BP is falling. Otherwise, it is not coming in the blood. But in the lungs, it is performing a normal function. Now, in our lungs, in human lungs, bradykinin substance P is formed as a metabolite. It causes cough. But we don't have cough. I don't have cough because in my lungs, ACE is present and ACE inactivate the bradykinin substance P. I'm having ACE. I'm having ACE in my lungs. So ACE is having two functions. In the blood, it come in the blood and convert angiotensin 1 to 2 whenever BP fall to restore the BP again. But in the lung, it convert bradykinin and substance P into inactive products. So these are the two functions of the ACE. Say yes. If you got this normal, now let me tell you about the mechanism of action of ACE inhibitors. Okay, now listen. Have you heard about the disease? The name of the disease is hypertension. Of course, you have heard. What is hypertension? Hypertension is the disease in which the BP is more. So it's very common. How many of you have hypertensive patients at your home? Maybe your parents, maybe your grandparents, maybe your relatives, maybe anyone, maybe you yourself or anyone. Hypertension is a very common disorder, especially after 50 years or 60 years of age. In old age, in old age, 60 to 70% of the people are hypertensive. We all will become, maximum of us will become hypertensive when we cross our 50s or 60s. So have you ever thought, why does it occur? Why does hypertension occur? बीपी की दवाई ले लो, बीपी हो गया है, तो ऐसा बोलते हैं ना लेमन लैंग्वेज में कि मेरा बीपी की बीमारी हो गई है. So that is hypertension. Okay. So what is the disease? Actually in old age, this family get activated. The family of 3 proteins and 2 enzymes. It should get activated when the BP fall. When the BP fall, you can see here, when the BP fall, they should get activated and maintain the normal BP again. But in old age, the RAS family become overactive. Even at normal BP, it get activated. My BP is normal. Once I become old, I will become more than 60 years, 50 years. So inside my blood, even I'm having normal BP, the renin and ACE will come. And renin and ACE will act on the 6 organs. They will act on the 6th organ, the angiotensin 2. So if the BP is less, by this family, we can maintain it normal. But if BP is already normal and this family is coming in the role, the person will be hypertensive. So this is the reason for hypertension. So maximum hypertension is due to overactivation of RAS. Say yes if you got it. How many of you got it? This is the reason. So what if you want to treat the BP? Now imagine a patient is coming to me. Patient is saying, doctor, I'm having headache since few days. I'm having feeling like pulsatile feeling and I'm having severe headache. I'm just measuring the BP. Oh my God, your BP is touching the sky. It's 160 by 100 or maybe and it's a consecutive raise. It's constantly raised. So person is hypertensive. So I want to treat the hypertension. I want to maintain the blood pressure again. So what is the cause? If you know the cause, you can treat it. The cause is these 2 enzymes are coming in the blood, even blood pressure is normal. So I will give a drug known as ACE inhibitor. Here comes the role of the ACE inhibitor. So what is ACE inhibitor? ACE inhibitor is a drug that inhibits ACE. No ACE. So angiotensinogen will convert into angiotensin 1. But angiotensin 1 cannot convert into angiotensin 2. Since angiotensin 2 will not come in the blood, on the sixth organ, it cannot act. It cannot act on the sixth organ, so BP will not rise. BP will remain normal only. So this is the main drug, the first choice of drug in hypertension. Say yes, ACE inhibitors. How many of you got it? Respond, yaar. If you got कुछ मजा आया पढ़ने में तो respond करो. Got it? This is the simplest version I'm telling you. Nowhere in this world will teach you like this is the simplest version. I'm telling you all the drugs in this manner. Say yes if you got it. So ACE inhibitors. ACE inhibitors are the drugs which inhibiting the enzyme ACE. No ACE, so angiotensin 1 cannot convert into 2. Angiotensin 2 will not form. Angiotensin 2 will not form. It will not act on the sixth organ. And it will not raise the BP. BP will normalize again. So this is first choice of drug in hypertension. This is the mechanism of action. Hana, you are inhibiting the enzyme ACE. So this function is inhibited. I want it. But unfortunately, this function is also inhibited. ACE was required at two places, na, in the blood, in the lung. So if you are giving ACE inhibitor, the ACE will be inhibited at both places. In the blood also it is inhibited. In the lung also it is inhibited. In the blood, I want to inhibit it. I want to control BP. But in the lung also, unfortunately, it will inhibit it. It will be inhibited. So bradykinin and substance P will not be inactivated now. And bradykinin and substance P will cause cough. Hana, cough is a side effect of ACE inhibitor. That's why the person always have cough. The person is on ACE inhibitor. Cough. The person will have angioedema. Okay, the person can have cough, itching, angioedema. This is all due to bradykinin. How many of you got it? So I have correlated the adverse effects also here. So this is the mechanism of action. What is the mechanism of action? Obviously. What is the name? ACE inhibitor inhibit ACE. Hana, ACE inhibitor is a drug. Obviously it inhibits ACE. लेकिन वो inhibit करने से होगा क्या? What will happen? Angiotensin 2 will not form. Angiotensin 2 will not form. It will not go to the peripheral six organs. It will not cause the increase in BP and BP will become normal again. Okay, so this is the mechanism of action. Okay, so you got the classification, the prill. You got the mechanism of action. Now three more things: uses, side effects, and contraindication. What are the uses? What are the uses? So for uses, I'm having a mnemonic. Home care makes patient definitely strong. H stands for hypertension. It is the first drug of choice in hypertension. Any hypertensive patient coming to me, I will give ACE inhibitor unless and until it is contraindicated. Okay, I will give ACE inhibitor, the first choice of drug. Okay, C stand for CHF, है ना, congestive heart failure. M is MI, है ना, myocardial infarction also we give ACE inhibitor. P is prophylaxis of MI. We give an MI also and as a prophylaxis of MI. D is diabetic nephropathy, है ना, which is our option right now. Okay, and S is scleroderma crisis. Home care makes patient definitely strong. This is my mnemonic. It is hypertension, congestive heart failure, MI, prophylaxis of MI, है ना, diabetic nephropathy, which is our answer right now, and scleroderma. So you can get question on any of them. Say yes if you got it. Uses. What are the adverse effects? The adverse effect, the mnemonic is captopril. Captopril, CAPTOPRIL, है ना. From the captopril, C for cough, okay, A for angioneuritic edema, and I for itch. These three are due to bradykinin. I told you na, that you are inhibiting the enzyme ACE. So ACE is inhibited in the blood also, in the lung also. In the lung, the substance P will not get inactivated, bradykinin will not get inactivated, and substance P and bradykinin will cause cough, edema, and itch. So these three are due to that. Okay. P, there are two P. है ना? One P is proteinuria, increase protein in the urine, and one P is potassium increase. In the blood, potassium will increase. ठीक है? T is taste disturbance. The taste get disturbed. Okay, O is others, it's non-specific, and R is renal impairment. Renal impairment. So please learn it. Please learn it. Okay, and contraindication is PARC. Absolutely right. Contraindication is PARC. Never give it in pregnancy. It's teratogenic. Never. P for pregnancy. A is allergy. Okay. R is renal artery stenosis. Renal artery stenosis or single kidney. Never give it in single kidney. And K is kalemia, hyperkalemia. If the potassium is already raised, it will further raise the potassium. Patient will have arrhythmias. If the potassium is already raised, so before offering ACE inhibitor to any patient, check the potassium level. If the potassium is already raised, never give ACE inhibitor. These are the four contraindications. How many of you got it? How many of you got it? People respond. So I taught you the complete chapter ACE inhibitor in just 10 minutes. Huh? Pura chapter ho gaya. Now do any question. The question is on uses, adverse effects, side effects, contraindication, mechanism of action, classification. You can solve it. This is a way. You have to do pharmacology. Okay, got it, Anna? So tell me the classification, tell me the mechanism of action, tell me the uses, tell me the adverse effects, tell me the contraindication. Revise it in 1 minute. Classification से मैं all prill. जितने भी prill हैं, all prill are ACE inhibitors. Learn two things. The captopril and lisinopril are not prodrug and rest all are prodrug. इस पे question आता है. Mechanism of action, it inhibits ACE enzyme. No ACE, no angiotensin 2. No angiotensin 2, on the sixth organ it will not function and BP will fall. BP will fall. है ना? It will maintain the BP again. Uses, I'm having a mnemonic. The mnemonic is home care makes patient definitely strong. You know the full form? Hypertension, congestive heart failure, MI, prophylaxis of MI, diabetic nephropathy, scleroderma crisis. This is the uses. Adverse effect, the mnemonic is captopril, CAPTOPRIL, captopril. Okay. C stand for cough. A is angioneuritic edema and I is itch. These are the three for bradykinin and substance P. Okay. P is proteinuria. 1P is potassium. Potassium will raise. है ना? T is taste disturbance and R is renal failure. Okay. And O is the others. Okay. Contraindication is PARK. PARK. Okay. K is potassium. If potassium is already raised, further it will increase. Don't give it. Don't give it. P is pregnancy. A is allergy. R is renal artery stenosis or single kidney. Now have a look on your question. Got my point? Got my point? Okay. Thank you so much for all your feedbacks. I'm really sorry. I have a look on the comment section and you frequently give compliment to me, but sometimes I don't respond because I don't want to waste even your single second. If you're giving me 2 hours, it should be each and every second useful for you. Okay. Thank you so much for your feedback. Thank you so much. From the depth of my heart, I'm thankful to all of you. Okay. Anyways, coming on the next question very quickly. The next question is in front of you. Pharmacodynamics deals with. Now, few questions from the general pharma. Pharmacodynamics deals with. Is it effect of drug on the body, effect of body on the drug, absorption of the drug or metabolism of the drug? What's the correct answer? Please guess fast. Yes, it is the effect of drug on the body. Let me explain you the basics. In pharmacology, we are studying pharma right now, pharmacology. There are 2 branches in pharmacology. Pharmacodynamics, which is known as PD, and pharmacokinetics, which is known as PK. We are having 2 branches, PD and PK. Listen. Now listen, this is a simplified version. I can explain you PD and PK. Pharmacokinetics and pharmacodynamics. Everyone on the screen, listen. Just suppose this is the digestive tract of a normal healthy person. I'm the person. I'm having some disease. Let's say I'm having headache. I'm not having it. I'm just taking an example. Just suppose I'm having migraine headache. So for that, you are a doctor. You are giving me a drug. Ma'am, take this tablet. You will be all right. So this is the drug I'm taking. I'm having headache. I'm having diarrhea. I'm having constipation. I'm having heart failure. I'm having any disease. You are giving a drug for that via oral route. So I will take the drug via mouth with water. So drug will go inside. Got it? Now there is a rule. Acidic drugs are absorbed from acidic medium, that is stomach. And basic drugs are absorbed from basic medium, that is intestine. Everyone knows stomach have acidic medium, that is HCl. And intestine have alkaline medium, basic medium. So there are 2 type of drugs. So I will come on this point also. There are 2 type of drugs, acidic and basic. Acidic drugs are absorbed from stomach. That is acidic medium, and basic drugs are absorbed from intestine, that is alkaline or basic medium. So for absorption, 2 different organs are responsible. Some drugs are absorbed from stomach, some are absorbed from intestine, depending which type of drug is it. That is the first thing. This step is known as absorption. This step is known as absorption. The drug get absorbed. Please understand. From this chart, I can claim 50 questions right now. Listen, please understand it. It's very important. Please. This step is known as absorption. What is absorption? It is the movement of the drug, the transfer of the drug from the site of administration till circulation. From the site of administration till circulation, till blood. The drug is moving. It is not necessarily you always give from oral route. Maybe you are injecting, maybe you are giving transdermal route, you are giving rectal route, vaginal route, any route. There are various routes. Ultimately, wherever you are giving, the site of administration, the drug will reach the blood. And this is known as absorption. This is known as absorption. Got it? This is absorption of the drug. After reaching the blood, the drug will go to its site of action. If you're giving it for headache, the receptors for that, now blood is going everywhere. The drug is going on all the organs, but that receptor for that drug is present in that particular organ, which is in which I'm having the disease. If you're giving a drug for migraine, the receptors for that shall be present in the brain parenchyma or brain blood vessels. If you're giving a drug for diarrhea or constipation, the receptors should be present in intestine. If you're giving a drug for heart failure, the receptors must be present in the heart. So accordingly, we give the drug. So basically, the drug will go to its site of action and shows its mechanism of action there. It will show its mechanism of action. Now my headache is treated, my diarrhea, whatever the disease, it is treated. Now I do not want to keep the drug forever in my body. I want to excrete it. Its job is done. I want to excrete it. So drug will come again in the blood and it will go to the kidney for excretion. It will ask the kidney to excrete. Most of the drugs are excreted in urine in the kidney. Very few are excreted in feces. So the drug will ask the kidney, can you please excrete me? The kidney will say, no, I cannot excrete you. Why? Because in the kidney, the drug is excreted in urine. Now, urine is what? Urine is water. It's liquid. So only polar drug can be excreted from the kidney. Most of the drugs are non-polar, है ना? So kidney can ask if first you get convert from non-polar to polar. If you get converted from non-polar to polar, then come to me. Then I can excrete you. But currently you are non-polar, I cannot excrete you. So drug cannot be excreted directly. Before going to the kidney, drug will enter the liver. What does the liver do? Liver convert non-polar drug to polar drug. And this step is known as metabolism. This step is known as metabolism. Metabolism or biotransformation, one and the same thing. Metabolism or biotransformation. It's one and the same thing in which a non-polar drug get converted into polar drug. And now the drug will go to the kidney for excretion. The excretion, now kidney can excrete it because it is a polar drug and it will come out of the body. Hannah, it is come out of the body. Hannah, I forgot to tell you, from the blood, whenever the drug is going to its site of action, it is known as distribution. So there are 4 steps. Hannah, I am taking a tablet by mouth. 4 things will happen one by one. The first thing, the drug get absorbed. The drug get absorbed. The first thing is absorption. From the mouth, it will go inside, absorbed, reach in the blood. This is absorption. From the blood, it will go to its site of action, that is distribution. Whatever is the site of action, it will go to that organ and show its mechanism of action. That is distribution. After that, it will go to the liver and get converted from non-polar to polar. That is metabolism or biotransformation. And finally, it will go to the kidney and get excreted out of the body. So these 4 things are what the body is doing on the drug. My body is absorbing the drug. My body is distributing the drug. My body is metabolizing the drug, and my body is excreting the drug. This is known as pharmacokinetics. Pharmacokinetics is what the body is doing on the drug. My body is first absorbing it, then distributing it, then metabolizing, and then excreting. So this is the 4 things which comes under PK. PK, pharmacokinetics में 4 चीजें आती हैं. What the drug is doing on the body is only one thing, mechanism of action. Drug is showing its mechanism of action. Got it? Drug is showing its mechanism of action on the site of action. This is known as pharmacodynamics. So pharmacodynamics have only one thing. What you got it? Huh? Pharmacokinetics, pharmacodynamics. Say yes. What is the definition? What is pharmacokinetics? What the body is doing on drug. Effect of body on drug. And what is pharmacodynamics? Effect of drug on body. You can learn like this. You can learn D for D. Pharmacodynamics is drug. D for D. You can learn like that. So here we have 4 branches. Here we have only one thing. Here it is absorption, distribution, metabolism, which takes place in liver, and finally excretion. You know the meaning of all of them. And here only one thing, mechanism of action of the drug. Say yes, people. Say yes. Everyone say yes. Thank you so much for all of your compliments. Thank you so much. Got it, everyone? So please learn the basics. What is pharmacokinetics? What is pharmacodynamics? Pharmacokinetics include what? Pharmacodynamics include what? Learn their definition. So this is the basic. Now I will explain everything about the pharmacokinetics and dynamics in this master diagram. Okay, now have a look on your question and tell me the answer. Read the question. They're asking pharmacodynamic. They're asking PD. PD is having only one thing. It is the effect of drug, D for drug, on body. Not effect of body on drug. No, it is effect of drug on the body. So correct answer is A, and you all can see. Can you answer this one quickly? What is pharmacokinetics? Pharmacokinetics include all of the following except. What is not included in pharmacokinetics? In pharmacokinetics, there are 4 things. Absorption is there or not there? Distribution is there or not there? Adverse effect, excretion. So I taught you 4 things. Now absorption, distribution, metabolism, and excretion. You can see adverse effect is not coming here. So my correct answer is C. It's very easy question. These all are your PYQs, people. Okay, so please concentrate. The next question is in front of you. Pharmacodynamics includes what? Pharmacodynamic, PD. Pharmacodynamic. Is it drug elimination? Is it drug excretion? Is it drug absorption? Or is it mechanism of action? Mechanism of action of the drug. So obviously the correct answer is mechanism of action. Okay, because pharmacodynamic have only one thing in that is mechanism of action at the site of action. So that is the correct answer. So you get easy question. Now coming on the next concept quickly. Okay, read the next question and tell me the answer. Acetyl salicylate and phenobarbital. These both are better absorbed from the stomach. Why? Why they are better absorbed from the stomach? What is the correct answer? First you tell me the answer, then I will give you complete concept about it. V drugs remain ionic or non-ionic at gastric pH, or strong acids or weak bases, they are ionized at gastric pH. What is the correct answer? Let me tell you. No, C is not the correct answer. It's a little bit confusing concept. Listen, everyone on the screen. Everyone come here and come here on the screen. Listen, this is a drug my patient is taking. You can see my patient is taking the drug from mouth. What do you want? You want the drug to get absorbed, or you want to get the drug get excreted? What do you want? You want more absorption, or you want more excretion? I'm asking you, answer. I'm asking you. Here is the drug, it is there in the blood now. It got absorbed. Now you want more absorption or you want more excretion? What do you want? I'm asking you. Most of the students are saying absorption. I know. Most of the students are saying absorption, right? I'm asking you, being a doctor, what do you want? You want the drug to be absorbed more or you want the drug to be excreted more? Say, ma'am, depends on the condition. No, we not always we need absorption. If there is a patient and I'm giving a drug to the patient for treatment, I want more absorption. Obviously, want more absorption, more fast treatment will be there. Okay, so absorption is right. But imagine a patient has done a suicide. The patient has taken a poisoning. It's a poisoning case. The patient has taken 100 tablets of sedative together, and the patient is in front of me unconscious. The parents are crying, doctor, please save my son, save my child. Hana, he has a poisoning case and it is a suicidal case or homicidal case. It is a poisoning case. So in that case, I do not want more absorption. I want excretion because I want to save the patient. I will save the patient only if the excretion is more. So it depends on the situation. It is not always we want the absorption. Say yes if you got it. So sometimes we want absorption, sometimes we want excretion. So what about the absorption? We will talk about the two things, absorption and excretion. We are having two types of drugs. Hana, weak acid and weak base. Most of the drugs are either weak acid or weak base. Strong acid and strong base do not ionize. Either we have weak acid or we have weak base. We have two type of drugs, weak acid and weak base, not strong. Strong nahi hote hain. Weak acid and weak base. Listen, for absorption, we have two different organs. है ना? Stomach and intestine. Weak acids are absorbed from acidic medium and weak base are absorbed from basic medium. है ना? So we have acidic medium in the stomach. So acidic drugs are absorbed from the stomach and basic drugs are absorbed from the intestine. I already taught you. Now the drug is gone. It has already shown its mechanism of action here. Now I want to excrete it. It is already gone to the liver, converted from non-polar to polar. Now I want to excrete it. For excretion, we have only one organ, kidney. Whether it is acidic drug or basic drug, we have only one organ, kidney. है ना? But we can change the pH of the urine in the kidney. है ना? For excretion, opposite medium is required. If you want to excrete acidic drug, the urine should be basic. If you want to excrete basic drug, the urine should be acidic. Got my point? Got my point? For absorption, same medium is required. Acidic drug, C. See everyone here on the screen. What I'm saying, I'm summarizing. For absorption, same medium is required. Acidic drugs are absorbed from acidic medium. Basic are absorbed from basic medium. That's why acidic are absorbed from stomach and basic are absorbed from intestine. But for excretion, opposite medium is required. Acidic drugs are excreted in basic urine and basic drugs are excreted in acidic urine. How many of you got it? Say yes if you got it. This is the thing I'm telling you. For absorption, same pH is required. Acidic are absorbed in acidic medium and basic are absorbed in basic medium. But for excretion, opposite pH is required. I'm telling you this. So acidic drugs are excreted in basic urine and basic drugs are excreted in acidic urine. Say yes. First say this yes. Then I will tell you the funda of ionic and non-ionic. Whatever drug you are giving, weak acid or weak base. What is the acid? All the acidic drugs have proton in that, like HCl, HNO3, H2SO4. So they have a proton. So like HCl, so H positive, A negative, HNO3, H positive, NO3 negative. Like proton will separate and this is the drug. Likewise, the basic drug have hydroxyl ion in that, like NaOH, KOH. You know the chemistry. My point is that don't learn all this. This is rubbish. Don't learn all this. Listen, my point is that this is the unionized form. This is ionized form. Ionized form is the splitted version. So drug is in two form. Unionized is the complete and ionized is the splitted one. Here also this is unionized and this is ionized. This one is unionized. That is complete. And this one is ionized. That is incomplete. It is splitted one. There is a rule. You have to learn the golden rule. Body keep the complete form. Body do not like the ion. Body excrete है. जब भी ion है, ये वाला form excrete हो जाता है. The ions are excreted. Whether it is acidic or basic, the ions are excreted. The unionized form is absorbed. Body absorb unionize and body excrete the ionized. Say yes if you got it. Say yes. Everyone got it? So the acidic drugs, they are absorbed in acidic medium because in acidic medium they are unionized. That's why they are absorbed. And basic drugs are absorbed in basic medium because in basic medium they are unionized. That's why they are absorbed. Okay. Acidic drugs at basic pH, they remain ionized, and basic drug at acidic pH, they remain ionized. That's why they are excreted. So this is the funda of ionized and unionized. So this is the master chart. You can solve many questions over here. Now have a look here. You should ask me the next question, ma'am. Is it possible to change the pH of the urine? You are saying that acidic drugs are excreted in basic urine and basic drugs are excreted in acidic urine. So how to acidify the urine or how to basify, alkalinize the urine? Can we change the pH of the urine? Yes, we can do so. Depending on the poisoning. Imagine there is a patient of poisoning in my clinic. The parents are taking a child which is unconscious and the parents are asking, my child has done a suicidal attempt and he has taken 100 tablets together. So the first question I will ask, which is the name of the tablet? Show me the empty, the strip. So looking at the tablet, whatever the drug the patient has consumed, the 100 tablets together, I will see whether it is an acidic drug or basic drug. If it is an acidic drug, I will alkaline the urine of this patient so that it gets excreted out as soon as possible. And if it is a basic drug, I will acidify the urine of this patient so that it get excreted out. So depending on the drug, the first question you have to ask the parents, the relatives, which drug, show me the anti-strep, by kaun si drug khai hai isne, hai na? It is acidic or basic, depending on that. So if you want to basify the urine, you have to start IV drip, है ना? It's an emergency. We will give directly IV drip of sodium bicarbonate. With sodium bicarbonate, the urine will become basic in nature, and acidic drugs get excreted out. And if you want to acidify the urine, you have to start 2 drips. First, you have to give arginine hydrochloride followed by ammonium chloride. So arginine hydrochloride followed by ammonium chloride, the urine will become acidic and the basic drugs will be excreted out. I don't know how many of you got it, but I tried my best. Got my point? Do you have any confusion over here? Read the question and tell me the answer. So acidic drugs are ionized at which medium? Can you solve it? Acidic drugs are ionized at which medium? Ionized means absorbed or excreted. Ions, body do not want ions. Body do not like ions. So body excrete ions. है ना? So acidic drugs are excreted in which medium? This is the simplified version. So acidic drugs are excreted in, for excretion, opposite medium is required. So acidic drugs are excreted in alkaline medium. This is how you have to attempt the questions. Okay. What is true about acidic drug? It is best absorbed in acidic medium or best absorbed in alkaline medium? Or it is not absorbed in acidic medium. So for absorption, same medium is required. So acidic drug is absorbed in acidic medium. So this is how you have to attempt. You get many questions out of that. Okay, got my point? Last question based on this. Then we will come on the next concept quickly. What is the best way to manage a patient present with arsenic poisoning? What is the best way to manage a patient with arsenic poisoning? By the way, if you don't know, arsenic is the acidic drug. Arsenic is the acidic drug. There is a patient who has taken 100 tablets of arsenic together. What you will do now? 100 tablets taken together. Aspirin poisoning aa gaya tumhare paas. So what you will do? You want to excrete it, na? So you want to basify the urine. You want to basify or alkaline the urine. For doing the basification of urine, you need sodium bicarbonate. So correct answer is B. And if I change here some of the acidic drug I give you, answer will become A. So in this way, if your concepts are clear, you can easily solve the question. So there are many questions. So coming on the next concept quickly, give me a thumbs up. You got this concept. The next concept is prodrug. All of the following are prodrug except which of the following is not a prodrug. All of the following are prodrug except. I'm asking you except. So first you give a attempt, then I will tell you the correct answer. The next one does the prodrug. Yes, what is the correct answer? Yes, the correct answer is the captopril. Absolutely right. Listen. What is the prodrug? I told you now, we take drug by mouth. So drug is going inside. The acidic drugs are absorbed by acidic medium and the basic drugs are absorbed from basic medium. Ultimately, drug reaches the blood. Now, drug reaches the blood. What I am supposed to do? This drug is supposed to go at the site of action and show its mechanism of action. It is supposed to go at site of action and show its mechanism of action. Yes or no? This drug. But some drugs do not show its mechanism of action because they are inactive. Some drugs are inactive. This is an inactive drug. Not all. Some drugs are inactive. These are prodrug. So they will go inside. They will get absorbed. They will go to their site of action, but they cannot show their mechanism of action. No, they cannot show because they are inactive. So first they have to go to the liver. Liver convert them from inactive form to active form. And then again they will come in the blood and now they will go to their site of action and show their action. So these drugs which are converted into active form in the liver, these are known as prodrug. So externally they are inactive. Once you will take it, they will go inside, get absorbed. At the site of action, they cannot show their mechanism of action. So first they will go to the liver. Liver convert them from inactive to active. And then again they will come in blood and then now they can show their mechanism of action. So these drugs are known as prodrugs. List the prodrugs. So I'm giving you a mnemonic. This is the mnemonic of the prodrug. This is the mnemonic of the prodrug. This is the mnemonic of the prodrug. Say yes. Got it. This is the mnemonic of the prodrug. So the mnemonic is all prefer doing MD in clinical subjects. Of course, you also want to do MD in clinical subject. It's a mnemonic. It's just a mnemonic. Learn. So A stand for ACE inhibitors. All pril. I told you now, all pril are prodrug except captopril and lisinopril, which is our answer right now. Captopril or lisinopril ko chhod ke all the prils except these two prils, all the prils are prodrugs. P stand for prednisolone, proton pump inhibitor and proguanil. These are the 3 P's. D for dipivafrin. M for mercaptopurine, methyl dopa and minidoxin. D for levodopa. So methyl dopa and levodopa both are coming. I is irinotecan. C is cyclophosphamide, clopidogrel, and carbamazine. And S is sulfasalazine. It is one of the sulfonamides. So don't try to mug up the list. Just have a look once, and if you know the list, if you have read it once in the options, you can easily get it. So I'm asking all of the following are prodrug except, so captopril is not a prodrug. Remaining all are the prodrug. They are coming here in the mnemonic. Say yes if you got it. So this is the concept of the prodrug. Can I come on the next question? Can I come on the next question? Before coming on the next question, a small piece of advice for you. Everyone dreams. You also dream. I also dream. We also have dreams. Hana, we have big dreams to achieve. But let me tell you something. Dreams don't work unless until you get up and work on your dreams to convert it into reality. Hana, just imagining your dreams will not going to help you. Hana, it is not going to help you to achieve your dreams. You have to work for that. Hana, so you should have dreams, but you should have enough courage to work for that and convert your dreams into reality. Dreams are not those which we see whenever we are sleeping. Dreams are those that make you not to sleep, that make you awaken all the time. Hana, you have heard this famous proverb, I guess. Okay, so let me come on the next question. The next question is in front of you. Read the question and tell me the answer. The next question is based on the metabolism. All the drugs are metabolized by acetylation except. So which of the following drug is not metabolized by acetylation? Very frequently asked question. Acetylation पे frequently question आता है. So which of the following drug is not metabolized by acetylation? The four options are in front of you. Is it phenytoin, isoniazid, procainamide, and hydrolazine? So what is the correct answer here? Can you tell me what is the correct answer? Yes, the correct answer is phenytoin. So do you know the mnemonic? What do you mean by the metabolization? Okay, listen, again the same diagram. Listen. Everyone come here. So I told you this is a drug we are taking by mouth. The drug go inside, got absorbed. Acidic drug from the stomach, basic from the intestine. It reach here. From the blood, it is going to its site of action, show its mechanism of action. Not drug want to get excreted. But kidney is saying, no, I cannot excrete you. First go in the liver, get converted from non-polar to polar, then come to me. So the drug is going to the liver and asking the liver, requesting the liver, can you convert me from non-polar to polar? Because I want to get excreted out of the body. But kidney is saying no. Kidney is saying first liver convert you from non-polar to polar, then only I will excrete you. So liver is saying yes, of course, why not? Come inside me. So I'm having hepatocytes. So you please enter inside my hepatocyte. In my hepatocyte, there is an enzyme. The name of that enzyme is cytochrome P450. That enzyme will convert you from non-polar to polar. Once you get converted into polar, you can go to the kidney and get excreted out. We can do this. So the drug is happily entering inside the kidney, inside the liver. And this is known as metabolism. So let me elaborate metabolism. Inside the liver, how does a non-polar drug get converted to polar? Inside the hepatocyte of the liver. What is the mechanism? How does it happen? So there are two types of metabolism. There are two types of metabolism, phase 1 and phase 2. Hannah, what do you mean by phase 1 and phase 2? So here also in phase 1 and in phase 2, both are taking place in the liver. Both are taking place inside the hepatocyte of the liver. Here also non-polar drug gets converted into polar drug. Here also non-polar drug gets converted into polar drug. But what is the mechanism? How does it happen? Here in phase 1, actually in the drug, in the diagram of the drug, in the structure of the drug, the functional groups are exposed. Hannah, the functional group can be hydroxyl, can be sulfur, can be methyl, multiple. So because of which non-polar drug get converted into polar drug. Hannah, this is phase 1. Hannah, and in phase 2, actually the non-polar drug is there. We do not expose the functional group. We will combine this drug with a polar component, with a polar molecule, polar endogenous molecule, and we will make a conjugate. Now the conjugate will be polar. Individual drug is non-polar, but when we combine it with a polar molecule, the complete assembly, the conjugate is the polar. This is known as conjugation. So phase 1 and phase 2. Phase 1 is functionalization, in which the functional groups are exposed, and phase 2 is conjugation. So by both mechanism, ultimate thing is non-polar drug get converted into polar. Say yes. So there are 5 types of phase 1. That is oxidation, reduction, hydrolysis, cyclization, and decyclization. In all of them, the liver convert non-polar to polar. And there are 6 types of phase 2. 6 types, depending in the liver. This is a non-polar drug. This is a non-polar drug. You want to convert it into polar. So first combine the drug with some endogenous polar molecule so that the conjugate which is formed, that is polar. So with which you are combining? You are combining with glucuronide, you are combining with glycine or glutathione or sulfate, methyl or acetylate. So these are the 6 types. Triple G, SMA. Hannah, I am interested in acetylation because my current question is based on acetylation. How many of you are getting it? So I am teaching you metabolism of the drug, which is also known as biotransformation. So the definition is to convert non-polar drug into polar drug, which is happening in the liver. There are two types of metabolism, phase 1 and phase 2. Phase 1 is of 5 types: oxidation, reduction, cyclization, decyclization, and hydrolysis. है ना? Phase 2 is of 6 types in which conjugation takes place. They all are conjugation in which various compounds are coming. So it's triple G SMA. है ना? It is glutathione, glycine, glucuronide, sulfide, methyl, and acetylate. So here I am interested in acetylation. Ideally, you should know the examples of all of them, but the time is limited. Currently, maximum questions come on acetylation. So our question is on acetylation. Let me give you the drugs which are metabolized by acetylation. So this is the list of the drug. Again, I'm having a mnemonic for you. The mnemonic is in front of you. The mnemonic is known as CHIPS ABC. What's the mnemonic? The mnemonic is CHIPS ABC. So C stands for clonazepam, which is a sedative. है ना? H stands for hydrolazine, which is an antihypertensive drug. It's a vasodilator. Okay, arteriodilator. I is isoniazid. It's an anti-tubercular drug. I taught you today. P is procainamide. It is an antiarrhythmic drug. Okay, S is sulfonamide. It is one of the antibiotic. A is acebutol. It is a beta blocker. Okay, B is benzocaine, and C is caffeine. So please learn. CHIPS ABC is the mnemonic. Now apply this mnemonic. Apply this mnemonic on your question. We are done. Read the question. All of the following drugs are metabolized by acetylation except. They are asking except. So what is the mnemonic, people? The mnemonic is CHIPS ABC. CHIPS. CHIPS ABC is the mnemonic. Now what is not coming in this mnemonic? I is coming. Yes, I is isoniazid. It's coming. H is coming. Yes, hydrolazine is also coming. There is one P. What is that? If you know the mnemonic, if you don't know the full form, it's good for nothing. So people, learn mnemonic, but learn the full form of mnemonic. Got my point? Mnemonic to KG ki bacche bhi learn kar lenge, but you have to learn the full form of that. What is this P standing for? Is it phenytoin or is it procainamide? That decides your answer. So this P is procainamide. So procainamide is also coming, but in this mnemonic, phenytoin is not coming. So phenytoin is not metabolized by acetylation. So if you can come on the answer if you know the full form. Say yes if you got it. Can I come on the next question? Again, a very important concept on which frequently there are PYQs in your exam. Say yes. Is it the session useful you are finding? Is it good? Maximum PYQs or frequently asked topics we are covering here. Okay, read the question. We will cover this concept also. All are enzyme inhibitors except. I'm asking all of the following are enzyme inhibitors except. First, read the question. You tell me what is the correct answer. Is it carbamazepine? Is it cimetidine? Is it valproate? Or is it ketoconazole? What is the correct answer here? Yes, the correct answer is carbamazepine. So how you came here? I mean, you know the mnemonic or you know the concept behind that. So you frequently get questions on enzyme inhibitors and enzyme inducers. Hannah, I will tell you both. So there are two types of enzyme. Some of them are inducers, some of them are inhibitor. Let me tell you. In the same diagram, you will understand. This is the last concept I'm telling you based on this diagram. Okay, listen, everyone here on the screen. Can you see here? Listen, the diagram. Imagine I'm taking, my patient is coming to me and I'm giving one of the drug to my patient based on the disease. Hannah, my patient is having fever. I'm giving paracetamol. As simple as that. It is going inside. Whatever drug I'm giving, it is getting absorbed. Acidic drug from acidic medium, basic from basic medium. Hannah, the drug have already shown its mechanism of action. Now I want to excrete it, but before excretion, the drug is coming to the liver for metabolism. So you will say, ma'am, it's okay. The liver will convert it from non-polar to polar. What is the problem in that? The problem is not there when it is only one drug. Hannah, let me zoom this liver for you. On the next page, the liver is zoomed. You can see this is liver. I'm zooming out the liver. Can you see this is liver, the same liver? Hannah, if I'm giving only one drug, there is no problem. But the problem is that patient don't come to us with one complaint. Patient come to us with multiple complaint. Doctor, I'm having acidity also. I'm having fever also. I'm having headache also. So I will give antibiotic also, paracetamol also, some antiemetic also, some, this also. So I will give multiple drugs. So whenever we give multiple drugs, just suppose I'm giving two drugs. This is drug A. When drug A was alone, drug A was going to the liver. Liver, can you convert me from non-polar to polar? Liver is saying, yes, why not? Come inside me. So this is my cell. Enter inside my cell. There is an enzyme. You can see the purple enzyme. The name of this enzyme is cytochrome. Cytochrome P450. That enzyme will convert you. The red drug was happy, very happy, drug A. It got converted from non-polar to polar and got excreted from the kidney. It was very happy. The things were super simple when we were taking only one drug. But now the problem is that we are taking B also. Along with A, we are taking B also. B, there is a problem with B. The problem is that this B is enzyme inhibitor. Can you see the minus sign? It is inhibiting this enzyme. This enzyme become non-functional. This enzyme become Gone, non-functional. B is inhibiting the enzyme. So what will happen? You tell me what will happen. Now A will come inside the liver. Liver, can you convert me from non-polar to polar? Liver will say, no, I cannot convert. I'm really sorry, I cannot do so because my enzyme got inhibited. There is another drug B, that has inhibited my enzyme. Now I don't have any enzyme, I cannot convert you. So you will remain as non-polar only. So this drug will remain as non-polar. It cannot excrete out of the body. Since it cannot excrete out of the body, it will cause toxicity. It will cause toxicity. It will remain in the blood only, and it will cause toxicity. So this is known as enzyme inhibition. So in enzyme inhibition, we are having two drugs. The red drug is known as substrate drug. For the substrate drug or parent drug, we are having the toxicity. And we are having a B drug, the green drug, the B one. It is known as inhibitor. So never give the substrate with the inhibitor. I will give you two lists. This is a list of the substrate, that is drug A. And this is a list of the inhibitors, that is drug B. Being a doctor, you should know this deadly combination. Never give any of this list to any of this list. Never. Not only for your exam purpose. After the exam, you will practice one day. Of course, you will practice. So never give this deadly combination to any of your patient. What if you do so? What if you give this combination? We will learn the mnemonics. What if you give this combination? You will say, ma'am, there will be toxicity of A. The patient will have toxicity of drug A. Drug A cannot be excreted. It will remain in the blood only. It will remain non-polar only. And the patient will have toxicity of all these drugs. Because drug B is an inhibitor drug. How many of you got it? Give me a thumbs up. Give me a thumbs up. Got it? Huh? So learn the mnemonic of drug A and drug B. Drug A is the substrate drug. The mnemonic is CT scan. CT scanner. C is cyclosporin or calcium channel blocker. T is tacrolimus. S is statins. Statins are the drug which are used for lowering cholesterol. C is cisapride. A is amiodarone. And N is navirs. You know all the navirs which are protease inhibitors we use in HIV treatment, anti-HIV drugs. And the inhibitors is vitamin K cannot cause enzyme inhibition. It's a mnemonic. V stand for valproate. K stand for ketoconazole. C stand for simantadine. Another C stand for ciproflox. E for erythromycin and I for isoniazid. है ना? Imagine my patient is having high cholesterol also and my patient is having TB also. So I cannot give the combination. You should know this deadly combination. Being a doctor, any of this list, don't give it with any of this list. If you are doing so, the first drug will have the toxicity. Say yes if you got it. Say yes. Say yes. So you have to learn the two list. है ना? Now this is the inhibition. Let me tell you the induction. Again, this time you are giving two drugs together. Hana, the red one and the green. If the red was alone, the drug was very happy. It was entering inside the liver, getting converted from non-polar to polar very easily and getting excreted. The story was happy ending. Okay, but the story is not simple. Na? The life is not very simple always. Okay, so there is another drug B. Hana? So gadbad karne ke liye B hai. So we are giving two drugs together. B. What is B this time doing? See, this time the drug is doing plus. Plus matlab it is inducing the enzyme. It is not inhibiting. This time the drug is inducing the enzyme. So this enzyme will become hyperactive. This enzyme will become hyperactive. Say yes. So what will happen? So it will convert this A drug to non-polar to polar very quickly. I want this conversion. I want this drug A to get converted from non-polar to polar, but after it has shown its mechanism of action. After it has shown its mechanism of action, then I want this conversion from non-polar to polar so that it get excreted out of the kidney once it get converted into polar. But here the enzyme become hyperactive because of drug B. It become hyperactive. So before it shows its action, the liver is converting it. Hana? So here, instead of toxicity, drug A have reduced efficacy. वहां पे टॉक्सिसिटी हो रहा था, यहाँ पे एक्शन ही नहीं दिखाएगा. You are giving two drugs, one is not acting among them. है ना? Even the patient is taking, but it is not showing its action because it is reduced efficacy. Before the drug shows its action, it get excreted. It get converted from non-polar to polar and get excreted because the enzyme inside the liver is hyperactive. I don't know how many of you got it. So again, you have to learn the same combination. The substrate drugs are same. Drug A is same, but B is changing this time. So again, CT scan. The substrate is CT scan only. This time you don't have to give CT scan with the inducers. The mnemonic of the inducer is in front of you. GPRS, cell phone battery dead. So GPRS, G stand for grisofulvin, P stand for phenytoin, R stand for rifampicin, S stand for smoking, C stand for carbamazepine, P stand for phenobarbital, B for barbiturate, which is one of the phenobarbital only, and D for DDT. Okay, so my point is that this is drug A. Never give it with enzyme inducer. Never give it with enzyme inhibitor. Never. So A, agar tum de rahe ho, if you are giving A to your patient, don't give it with this list also. Don't give it with this list also. If you are giving drug A, that is your substrate drug, with the inhibitors, with the inhibitors you are giving, so substrate drug will have toxicity. And if you're giving with the inducers, the substrate drug will have reduced efficacy. So substrate drugs either will have more action, that is toxicity, or less action, that is efficacy, if you are doing this combination. So learn the three lists together. Among the three lists, you have to learn the first list, that is substrate. You don't have to give the substrate either with inducer or with inhibitor. So you have to learn these two lists. So never use this deadly combination. How many of you got it? How many of you got it? Say yes. So I mean to say the substrate drug is CT scan. CT scan. First learn the full form of CT scan. Never give CT scan with the inducers. The inducers are vitamin K cannot cause enzyme inhibition, and never give them with the inducers. The inducers list is GPRS, cell, phone, battery dead. So never use this combination also, and never use this combination also. Everyone give me a thumbs up. Everyone. These are inducer and these are inhibitor. I have said reverse, I guess. Vitamin K1, it is the inhibitor. I have written opposite. Vitamin K wala mnemonic is for inhibitor, and GPRS, cell phone, battery dead is inducer. I hope you all got it. So please learn the three list at the tip of your tongue. Now you can answer the question. Got my point? Now you can answer the question. Have a look on the question. Now you can answer. I'm asking the list for the inhibitors. Which of them? All of them are inhibitors except. All of them are inhibitors except. So the mnemonic is vitamin K cannot cause enzyme inhibition. All of them are inhibitors except. So you can see valproate, it's coming in the list. Ketoconazole, it's coming in the list. Simantidine, it's coming in the list. But the next C is ciproflox. It's not carbamazepine. So the answer is carbamazepine. It is not an inhibitor, it's an inducer. So if you know the mnemonics, the things will become super easy. Everyone got it? Everyone got it? Do you have any confusion here? Say yes, say no, say something. People respond. Say. Now one more thing. Hoffman's elimination, the last thing. Listen. Everyone on the screen. Listen, people, listen. Now here is the drug. Here is a drug. Okay. The drug you are taking, you are giving a drug to your patient. It is going inside, getting absorbed. You know how it will be absorbed. It is there in the blood. It has already shown its mechanism of action. Now it want to excrete. But you know, there are some people in the world which are very self-dependent. No, they don't rely on others. Okay. So this drug is not going to the liver for getting converted. It is a non-polar drug. So we are asking the drug go in the liver, get converted from non-polar to polar, and you will be excreted out of the kidney. Without doing so, you cannot excrete. So drug is saying, no, I'm a self-dependent person. I will not take the use of the enzymes present in the liver. I do not want their use. Without their use only, I want to get converted from non-polar to polar in the blood itself. So is it possible? It is possible only in one drug. And this is known as Hoffman's elimination. Hoffman elimination, the drug get converted from non-polar to polar in the blood itself. In the blood itself, by doing certain molecular rearrangement, the drug will be able to do so. So without the agency of enzyme, without the help of the enzyme cytochrome P50, 450 present in the liver, the drug get converted from non-polar to polar because it is a very self-dependent drug. It do not want to take the help of anyone. No, without taking help of enzyme, it is getting converted. Only one drug do so. It is known as atracurium. The name of the drug is atracurium, and the name of this process is Hoffman's elimination. So what is Hoffman's elimination? What is Hoffman's elimination? Hoffman's elimination is spontaneous conversion of non-polar to polar by doing molecular rearrangement without taking help of the liver enzyme. It is the definition. You frequently get question on that because it is only one drug, atracurium. Please learn that. So I'm giving you few questions, people. But in each question, there are hundreds of questions hidden in that. So we are solving all of them. Can we go ahead? Yes, it is one of the anesthetic drug. Okay, can we go ahead? Read the next question, tell me the answer. All of the following drug, which of the following drug is an enzyme inducer? Which of the following drug is an enzyme inducer? What is the list of enzyme inducer, people? GPRS, cell, phone, battery dead. So among this, which is coming in this mnemonic? What is the other mnemonic? The other mnemonic is vitamin K cannot cause enzyme inhibition. So C, rifampicin? Yes. So answer is rifampicin. Rifampicin is coming in this list. But what about the isoniazid? Isoniazid is coming in, isoniazid is coming in other list. Why I cannot use the pen? Isoniazid is coming here. Ketoconazole is also coming in the other list. And erythromycin is also coming in the other list. So other three are enzyme inhibitor. Only one of them is enzyme inducer, that is rifampicin. If you know all the list, you can answer it very easily. Okay, got it. Got it. So you get many questions on that. Read the question, tell me the answer. Hoffman's elimination is what? Can you define what is Hoffman's elimination? Is it inactivation of the drug by metabolizing enzyme? Yes, by using enzyme. or it is unexchanged excreted by the kidney, or is it excretion in the feces, or is it inactivation just by doing molecular rearrangement without taking the help of the enzyme? Yes, the correct answer is D, and you all are right. You all are right. Got it? How many of you got it? Let me see if we are having just a second. Few more conceptual questions. I will explain you. Otherwise, we will end the session. Let me see. Let me see. I guess we have done many questions, right? Huh? You have any topic, further topic in your mind, which is frequently asked in your exams, and you want me to teach that in the pharmacology I'm asking. So many questions which are repeated asked in the limited time. I try to cover many concepts. I know the time is limited. If the time was more, I shall cover more questions, but I try to cover maximum questions here. Okay. So I would like to stop here. I guess I would like to stop here. Okay. Thank you so much for being with me. Just a second. Anna. And we are having more session. Anna, let me announce my next session. Just a second. So I guess we have already covered the PYQs of PSM yesterday. We have already covered the PYQs of PSM yesterday. Today we have covered the PYQs of pharmacology, and we are having one more session, the PYQs of pathology. So the third session is pending. It is there on the 5th of January. On 5th of January, I guess I want to meet you all again, FMG aspirants. So before you go to your exam, I will teach you many PYQs, important topics in the pathology. Okay, so I want to see all of you on the 5th January. The timings will be same. It will be from 10 o'clock in the evening, 10 p.m. to 12:30, somewhat around. In the night only, in the late evening, we will take that session. Thank you so much. Thank you so much for being with me and giving your precious time. I would like to wish all of you the best of luck for your exam. Okay, I want to clear your exam in this shot only. Give your best shot. Whatever best you can do this time only. Don't wait after 6 months. There will be a reattempt. No. Okay, got it. Wishing you all the best. Bye-bye. And I'm just ending the session. Good night. Bye-bye. Study hard. Wishing you best luck. Bye-bye.